The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Hello, good day everyone, and welcome to Pearl's Anatomy and Histology. So it's me again. I am Ernest Paul Calasans, your anatomy teacher. No? So today we'll be going to have a rundown of anatomy and histology contents, no, which my basis for this lecture is the board exams, no, since 2019, no. So kung may babaunin talaga kayo sa board exams, okay, definitely ito na yon, no, kasi all of my contents here natanong na in the past 5 years, no. So okay, let's start. Okay, so we'll start first with general and miscellaneous topics. Okay, for the first question, so the largest organ of the body. Okay, same question, no? Exact question yung tinanong, no? However, in surgery exam actually siya tinanong. Okay, pero it's still an anatomy question, no? So the largest organ of the body: A, stomach; B, small intestine; C, brain; D, capillaries; E, skin. Okay, so the correct answer here is, okay, letter E, no? Your skin, no? It is the largest organ of the body, no? However, no, pag nag-iba yung sentence, no, nag-iba yung preposition, pag the largest organ inside, within, or in the body, ang answer natin would be your stomach. Okay, again, largest organ of the body, it's your organ of the body, it's your skin. Okay, pag pinilitan in, inside, or in, nasa loob, or visceral, largest visceral organ of the body, no, ang sagot would be your liver. Okay? Okay, again, inside, liver. Okay? Next. Okay? Capillaries, hindi siya, no? It has the largest cross-sectional area among all the blood vessels, no? Versus veins and capillaries. Veins and your arteries. Okay, capillaries has the largest cross-sectional area. In the GI system, the small intestines naman, no, has the largest cross-sectional area. Okay? Wala lang, may classmate kasi ako, sinagot niya dati before stomach kasi daw ang capacity niya is 1,500 ml. No? Hindi yan yung sagot, ha? Okay, it's not your stomach. Okay? Definitely not your brain. Okay? So yun lang. Okay, next. So the normal gallbladder capacity, again, tinanong, 2019 to, 2019 question. What is the capacity of the gallbladder? Okay? 10 to 30, 30 to 50, 50 to 70, or 70 to 90? Okay, the correct answer here is, okay, 30 to 50 ml. Okay? Pero in that question, nung 2019, no, I think isa lang sa values na yan yung lumabas. No? So either, but basta the range would be 30 to 50. Okay? Always remember this table and these the following mnemonics. No? Kasi ito definitely natanong na and possible itanong pa ulit in the future. Okay? Anong mnemonic natin? Again, the dudes with 10 inches. Okay? Mga dudes with 10 inches. Sino sila? Duodenum, okay? Ureter, descending colon, esophagus. Okay? And sigmoid colon. Your sigmoid colon is 10 to 15 inches. No? Pasok pa din sa 10 inches. Natanong na si duodenum, 10 inches. Natanong na si ureter again, no? Patok pa rin, 10 inches, ureter. Esophagus, natanong na din. Okay? Again, 10 inches. No? So, baka next na itanong na si descending colon. Okay? Dudes with 10 inches. Pero yung 5 inches, the mnemonic is sarap. Diba? Sarap. Okay? 5 inches si stomach. Si ascending colon. si rectum, saka si appendix, no? Si stomach, 5 inches, no? Pasok sa range. Sino pa? Si ascending colon, okay? Si rectum, 5 inches din. And si appendix, no? 3 to 5 inches. Okay? Dudes with 10, sarap, 5 inches. Okay? Sino pa mga possible itanong? So, sa urinary system, again, si ureter. The bladder has 500 ml, no? So, sa the following tables, dalawa lang yung capacity na i-memorize, no? Gallbladder, 30 to 50. Urinary bladder, 500. Okay? Sa urethra, wala naman masyado, no? Oh, just take note, the membranous urethra, it is the shortest, no? 0.5 inch. The penile urethra, longest, 6 inches. Okay? Male versus female, definitely male has a longer urethra. Okay? 8 inches. Okay? In females, 1.5 inches. Okay? However, no, may ganitong question, no, sa board exam, no, it was 2021 ata, no? 2021. What is the normal gallbladder weight? So before natanong na yung capacity, no? Pero iniba nila yung question, ginawa nilang weight, no? So gagawin natin, again, 30 to 50 ml yung capacity. Remember? Yung 30 to 50 ml, since ml is a measure of volume, di ba? Okay, we need to convert it into weight. Okay? Okay, by converting it into ounces, no? Which is a measure of volume and weight. Okay? And we're in 1 ounce is equivalent to 29.5735 ml, around 30 ml. Okay? So your gallbladder is around, if you convert it, 1 to 1.69 ounces. Okay? Tanong na. Okay? Did you get it? Okay. So, carry na yan, ha? Paikot-ikotin ka dyan. 30 to 50 ml or 1 to 1.69 ounces. Okay? So, moving on to your head and neck. Okay? So, ano ba mga tinatanong sa head and neck? Okay? Starting with this question, the structure that passed through the foramen spinosum. Okay? Lesser petrosal nerve, middle meningeal artery, internal carotid artery, facial nerve, or labyrinthine artery. Okay? So, the one that passed through foramen spinosum. Spinosum, it's your middle meningeal artery. Okay? So, if you remember here, your cranial fossa, okay, is divided into, your cranial base of the skull is divided into 3 cranial fossa. Okay? So, ito yung base of the base of the skull, sorry. Okay? And then, this is your lesser wing, this is your lesser wing of sphenoid. No? So, it divides the middle, okay? It divides the middle and your anterior cranial fossa. Okay, the lesser wing of your sphenoid bone. Okay? While your petrous part of temporal bone, it's here. No? It divides your middle cranial fossa, okay, to your posterior cranial fossa. Again, base of the skull, you have 3 cranial fossa. Yung anterior and middle is divided by the lesser wing of sphenoid bone. Okay? Your middle and posterior is divided by the petrous part of your temporal bone. Okay, so in total, you have 3 cranial fossa. Okay, and in each fossa, merong mga smaller butas, no, known as the foramina of the skull. Okay, so ayan sila. Sa anterior cranial fossa, you only have 1, but these are perforations, so maliliit na butas. Okay, this is your cribriform plate of ethmoid bone. Okay? Cribriform plate of ethmoid bone. Okay? And then, okay, in each butas pala, no? Again, in anatomy, basta may butas, may pumapasok or may lumalabas, may dumadaan. So, foramina in here, in the anterior cranial fossa, the cribriform plate of ethmoid bone, okay, it allows passage of your olfactory nerve bundles. Okay? Cranial nerve 1. Okay? Sige, moving on, sa middle cranial fossa, medyo madami. Okay? You have the optic canal, okay, which allows passage of cranial nerve 2 and ophthalmic artery. Okay? Optic and ophthalmic, no? Sounds like optic, ophthalmic sa optic canal. Okay? Optic, ophthalmic, optic nerve. Okay? Superior orbital fissure. Okay? Superior orbital fissure. It's allows passage of cranial nerve 3, 4, 5, 6 in your superior ophthalmic vein. Okay? Superior orbital fissure, superior ophthalmic vein, saka 3, 4, 5, 6. However, remember, your cranial nerve 5, okay, your cranial nerve 5, trigeminal nerve, no, has 3 divisions. Okay? Ang dumadaan lang sa superior orbital fissure, yung V1, your first part, no, which is your ophthalmic division. Okay? Ophthalmic division. Okay? So, yon. Superior orbital fissure, 3, 4, 5, 6. Pero cranial nerve 5, ophthalmic division only. Together with your superior ophthalmic vein. Next, your foramen rotundum. Okay, si rotundum, again, it's also cranial nerve 5, pero V2. Your V2 is your maxillary division. No? Maxillary division. Okay, paano daw matatandaan? Okay, you remember, okay, RX, no? RX, ano ibig sabihin? Parang prescription, no? Kasi, R, si rotundum, no? For maxillary division. Rotundum, maxillary division. Okay, hindi pwede kasing RM, no? Kasi yung third division is, mandibular, letter M din. So, you remember the X, no? RX, rotundum, maxillary. Okay? The next foramen is your foramen ovale. Okay, your foramen ovale, this is V3, no? V3, which is your mandibular division. Okay? Mandibular division of cranial nerve 5. Okay? Together with your lesser petrosal nerve, okay? And accessory meningeal artery. Okay? Paano daw matatandaan? Okay? Makinig mabuti. Si Mandy, no? Si Mandy naglalakad sa oval, no? Si Mandy naglalakad sa oval kasama ang kanyang maliit na pet. Maliit na pet, si lesser petrosal nerve. Again, si Mandy naglalakad sa oval kasama ang kanyang maliit na pet. Okay? Mandibular, foramen ovale, lesser petrosal nerve. Okay? Oops. Okay? Next, no? Your foramen spinosum. Okay? Ito na yung nasa question, no? Spinosum, middle meningeal artery, no? Ito corny ulit, no? Kasi di ba yung mga nag-MMA, parang mga wrestling, prone sila magka-injury sa spine. Okay, wali. I-memorize na lang. Okay? And then your foramen lacerum, no? Foramen lacerum, it allows passage of your internal carotid artery. No? Again, paano daw matatandaan? Okay, pag lacerum, no? Lacerum, pag ikaw ay laseng, parang laseng, no? Laseng, paano ka maglakad? Ika-ika ka, no? Okay, sige. I-memorize na lang ulit. Okay? So, sige. Answer natin ibang choices. Si lesser petrosal nerve, saan siya? Lesser petrosal nerve. Ay, sorry. Hindi pa pala natin complete, no? Meron pa pala, no? Sorry, yan. May posterior cranial fossa pa pala, no? Excited yan. Okay? So, sa posterior cranial fossa, you have the internal acoustic meatus. Okay? It allows passage of cranial nerve 7, 8, together with your labyrinthine artery. Okay? So, your labyrinthine artery, no, sa arterial supply going through your ears, no. Cranial nerve 8, no, vestibulo-cochlear nerve. Okay, while your cranial nerve 7 is your facial nerve. Nakikiraan. Okay? Now, mayroong board exam question. Sabi niya, a patient, blah, 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 has injury in your internal acoustic meatus, no. Cranial nerve 8 is injured. No? What other cranial nerve would you expect to be injured as well? Okay? So, ang magiging sagot, yung kasama niya doon. Okay? Cranial nerve 7. Okay? So, moving on, your jugular foramen. Jugular foramen, it's your 9, 10, and 11. Okay, 9, 10, 11. Together with the following structures, no? Inferior petrosal sinus, sigmoid sinus, posterior meningeal artery, no? Etc. Okay? Your hypoglossal canal, definitely hypoglossal nerve, cranial nerve 12. Okay? Walang mnemonic na dyan, no? Kaya mo na yan, girl. Okay? Your foramen magnum, okay? Foramen magnum naman, allows passage of cranial nerve 11. Okay? Together with the medulla oblongata and vertebral arteries. Okay? So, yan. Sagutan na natin yung question. Ayan. Si lesser petrosal nerve, again, si Mandy kasama, naglalakad sa oval, no? Foramen ovale. MMA, no? May injure ang spine, no? Spinosum. Internal carotid artery, no? Ika ka pag ikaw ay laseng, no? Lacerum. Okay? Si facial nerve nakikiraan sa internal acoustic meatus. Okay? Meatus, blah. Then, together with your labyrinthine artery and your cranial nerve 8. Okay? Get na? Okay? Memorize nyo na yan. Okay? Perfect. Okay? Ito, past 2 exams din, no? Lumabas. No? Which of the following structure does not pass in the lateral wall of the cavernous sinus? Cranial nerve 3, 4, V1, V2, cranial nerve 6. Okay? So, answer in this question is, sa recall question lang, no? Cranial nerve 6. So, your cavernous sinus belongs to the venous system of your brain. Okay? Malaki siya and maraming dumadaan din sa kanya as well. Okay? So, it includes your internal carotid artery, cranial nerve 6, no? Your abducens nerve. Okay? Yun yung dumadaan within the substance of your cavernous sinus. However, there are other structures in the lateral wall of your cavernous sinus. Okay? Your cranial nerve 3, 4, and 5. Okay? Cranial 3, 4, 5. Pero ophthalmic and maxillary divisions only. Okay? Sa lateral wall, 3, 4, 5, 6. However, it's just V1 and V2. Okay? Medially, okay, you can see your pituitary gland. Okay? So, looking at this picture, yung sibuyas is your pituitary gland. Okay? The blue part, this is your cavernous sinus, no? Sinuses. You have the left and the right. Okay? Within its substance, nandun si internal carotid artery. Okay? Continued yan, no? Naputol lang for the picture. And then, you have your cranial nerve 6 here, no? Your abducens nerve. Okay? Yun ang nasa substance ng cavernous sinus. And then, you see the other nerves in the lateral wall. Okay? Your 3, 4, and V1 and V2. So, clinical correlation. A 5-year-old boy is noted to have severe pain and swelling and redness around his right eye. Okay? He was diagnosed to have periorbital cellulitis. Which of the following routes describes the probable avenue of spread of the infection to the brain? Is it through the cribriform plate into the meningeal space? Is it through the facial vein to ophthalmic vein to cavernous sinus into dural space? Is it through the frontal sinus into the sagittal sinus and then enter the subarachnoid space? Or through the facial canal and then through the internal acoustic meatus to the posterior cranial fossa? Okay? So in short, paano daw dadaan yung infection from the face, okay, going to the brain? Okay? It will pass through your facial vein, the ophthalmic vein, to cavernous sinus into the dural space. No? So that would be a case of cavernous sinus thrombosis. Again, no? Tinanong na, past 2 exams. Usually, it results from infections in the orbit, nasal sinuses, and superior part of the face. No? And how does it spread? No? That's because your facial veins have important connections to your cavernous sinus, no? Through your superior ophthalmic veins. Okay, looking here. So, these are the veins of your face, no? So, pag nagkaroon ka na ng infection at the upper part of the face, no? Saan sila dadaan, no? Itong mga veins na to, it will drain here, no? in your superior ophthalmic vein. Okay? And then, eventually, it will reach your cavernous sinus, no? Leading to a cavernous sinus thrombosis. Okay? Kaya, clinically, important yung mga infection in the upper part of the face because it can easily spread to your brain. Okay? Most common cause would be Staphylococcus. Okay? And ito yung tinanong, no? The treatment of your cavernous sinus thrombosis. Okay? The treatment, since the cause is infection, the treatment would be high dose of antibiotics. Okay? Antibiotics. Okay? And then, it would need surgery to drain the infected sinus and eventual steroids. Okay? For the inflammation. Huwag malilito, no? Kasi before, may lumabas na anticoagulants sa choices, no? Not because thrombosis siya, ang treatment is anticoagulants, no? You treat the cause of thrombosis, which is infection. So, the treatment would be high-dose antibiotics. Okay? So, moving on further into the brain, no? Pituitary gland, no? Since 2019, walang mintis tinanong ang pituitary gland. Okay? No joke. Okay? So, kung may gland ka, i-memorize talaga, ito na yon, no? Pituitary gland. So, your pituitary gland is related anteriorly to which structure? Ay, hindi binasa yung choices. Sphenoid sinus, optic chiasma, cavernous sinus, basilar artery, and dorsum sellae. Actually, all of them are related, no? All of them are nearby your pituitary gland, but the one located anteriorly is your sphenoid sinus. Okay, your sphenoid sinus. Okay? So, discuss natin lahat about pituitary gland. Okay? Ito na yung bala mo, no? Basta pag may lumabas sa pituitary gland, definitely, sure ako, masasagot mo yan. Okay? Your pituitary gland or your hypophysis cerebri, okay? It's a small oval structure attached to the undersurface of the brain through your infundibulum. Okay? So, it's connected to the hypothalamus, specifically, through your infundibulum. It's well protected by virtue of its location, okay, in the sella turcica. Okay? Known as your master endocrine gland. Very grade 2 question. The master endocrine gland. Okay? Relations ng pituitary gland. Okay? This is your pituitary gland. You have an anterior part and a posterior part. Okay? Anteriorly, hindi ata kita, pero in here, no? This is anteriorly, you can see your sphenoid sinus. Okay? Part here. This is your sphenoid sinus. Okay? Next. Posteriorly, you have your dorsum sellae. Okay. Saan yung dorsum sellae? It's here, no? Dorsum sellae. You have the basilar artery here, the red part. Okay? And the pons. Okay? Pons here. No? Lahat sila, no? Sa likod. Dorsum sellae, basilar artery, the pons. Okay? This is your sella turcica. Sella turcica, by the way. Okay? Protected siya dyan. Superiorly, you have your diaphragma sellae here. Okay? And one important structure, no, for vision is your optic chiasma. Okay? So that's why if you have pituitary adenoma, no, or pituitary tumors, okay, so pag nag-enlarge yung pituitary gland, it can compress your optic chiasma, no, leading to a visual defect, no, bitemporal hemianopsia. Okay? Natanong din yun. Inferiorly, you have the body of sphenoid. Okay, body of sphenoid, yan. Okay, laterally, as you remember kanina, di ba, yung sibuyas, no, sa sides niya, nandun yung cavernous sinuses, laterally, no? Bilateral. Okay? So, yan ang mga relations ng yung pituitary gland. So, your pituitary gland has two parts, which differ developmentally, structurally, and functionally. You have an anterior pituitary. Okay? You have your anterior pituitary, anterior pituitary or your adenohypophysis, and your posterior pituitary or neurohypophysis. Now, again, madaling tandaan, anterior adeno. Okay, anterior adenohypophysis. And you'll get by its name, no? Adeno, meaning glands, no? So, pag tinanong ka, which part of the pituitary gland, okay, has an endocrine function, okay, it's your endocrine function, that's your anterior pituitary, no? So, anterior pituitary. Your posterior pituitary is part of the nervous system, no? Neurohypophysis. It's not, does not secrete hormones. Okay, ito din, no? 2019 din to tinanong. Okay, the hypophysis cerebri receives its blood supply from subclavian, middle meningeal, internal carotid artery, anterior cerebral artery, middle cerebral artery. Okay, so it comes from mga hypophyseal, superior and inferior hypophyseal arteries, which is a branch of your internal carotid artery. So the blood supply is coming from superior and inferior hypophyseal arteries, okay, which are branches of your internal carotid artery. Okay, sige. So we'll start first with the posterior pituitary. Again, neural yung function niya, no? It's also derived from the nervous system, no? From your neural ectoderm. Okay, it is a downgrowth of your diencephalon. Again, it's not really a gland, no? Because it only stores hormones. Okay, it only stores and release, no? Stores and release hormones, but it does not produce, no? It does not produce hormones. Okay, one peculiar histology feature of your posterior pituitary, you can see your herring bodies, no? That's where the secretions, no, are stored, no? Aggregation of secretions. Your herring bodies, okay, it's located in your posterior pituitary. Okay, in your posterior pituitary, okay, again, it's attached to your hypothalamus. The portion attached to your hypothalamus is your medial eminence. Eventually, it will continue to become your infundibulum or your pituitary stalk, infundibular stem, hypophyseal stalk. Okay, all of them refers to the same thing. Okay, infundibulum. Okay, so it's a downward extension of your median eminence. Eventually, it will become pars nervosa distally. Okay, what's the importance of your pituitary stalk? It contains the hypothalamo-hypophyseal tract. No? It's a tract that contains axons, okay, from the supraoptic and paraventricular nuclei of your hypothalamus to go into your posterior pituitary. Okay, you remember, your supraoptic and paraventricular will produce the hormones, no, oxytocin and ADH, no. Eventually, dito sila dadaan, no, sa hypothalamo hypophyseal tract in your infundibulum to eventually reach your posterior pituitary where it will be stored. Yan. Okay, specifically sa pars nervosa sila mas-store. Okay, again, no? This is your hypothalamus. Okay, portion of hypothalamus. Okay, to connect to your pituitary, it's your median eminence. Will continue to become your infundibulum. Okay, eventually, inferior expansion is your pars nervosa. Okay, again, natanong about the hormones naman, no? The hormones that travel along your hypothalamo hypophyseal tract. Okay? So, nabanggit ko na, no? Sabi ko na. Prolactin, vasopressin, growth hormone, ACTH, o both A and B. Again, the hormones that travel will be your vasopressin, or ADH, together with your oxytocin. Okay? So, letter B only. Okay? So, moving on, your anterior pituitary, okay, it's derived from an outgrowth of Kuratke's pouch, okay? It's a part of the gland that synthesizes hormones, okay? Ito na yung nagsisynthesize ng hormones. So, the subparts, you have the pars distalis, okay? You have pars tuberalis, no? Mainly secreting gonadotropes, okay? And your pars intermedia, okay? The one that produce MSH. Okay, so this is your anterior pituitary. Okay, this is anterior part No? The largest subportion is your pars distalis. And then, in between the pars distalis and pars nervosa, you have your pars intermedia. Okay? And the one that surrounds your infundibulum is your pars tuberalis. Okay? So as mentioned, the pars distalis is the biggest subpart of the gland, your anterior pituitary, and nearly produces all hormones, no, secreted by your pituitary gland. Okay? Natanong na din ito, which of the following are acidophilic cells? Okay, somatotropes, mammotropes, thyrotropes, corticotropes. Okay? The one that are acidophilic cells are your somatotropes and your mammotropes. Only A and B, no? So ano ba 'yan, no? So in your pituitary gland, you have chromophils and chromophobes. Okay? Two types of cells, chromophils and chromophobes. Your chromophobes, they are non-secretory, okay, and comprise around 65% of the epithelial cells. While your chromophils, they are divided into two, acidophils or alpha cells. Madali naman tandaan, acidophils or alpha cell, letter A. Or your basophils or your beta cells, letter B naman parehas. Okay? Your acidophils include your somatotropes, no, secreting growth hormone, and your mammotropes secreting your prolactin. Okay? While your basophils, you have TSH, ACTH, LHN, FSH, no, together with your MSH. Okay? Remember in your physiology, no, naturo yung mnemonic na B flat major. Okay? B flat major. What does it mean? Your beta cells, no, will secrete FSH, LH, ACTH, TSH, and your MSH. Okay? B flat major. Okay? Gets natin? Yes. Okay? One clinical correlation, no, natanong in the last exam, pero hindi niya exactly ma-recall, no, kung anong, last exam, pero hindi nila na-recall kung paano siya tinanong, no, about your pituitary apoplexy. No? It's an endocrine emergency caused by a sudden hemorrhage in your pituitary gland, no, due to a underlying pituitary adenoma. So, if the adenoma is too large, no, and it's a tumor, remember, so mataas yung vascularity, then eventually mag-rupture yung vessels, it will lead to a sudden hemorrhage in your pituitary gland. So they present with headache, diplopia, no, pressure in the cranial nerve 3, hypopituitarism, no, and it could cause as severe symptoms like cardiovascular collapse, loss of consciousness, and the worst, no, sudden death. Okay? Okay, next question, no? Ito na yung sinabi natin, no? Pituitary adenoma, it expands superiorly, no, and compresses the central portion of your optic chiasm. Okay? It will result to what type of visual field defect? Okay? Total blindness, loss of left and right inferior fields of vision, loss of left and right nasal fields of vision, or loss of left and right temporal fields of vision. Okay? So, the answer here is, no, again, pag optic chiasma, it's bitemporal hemianopsia. So, you will lose temporal sides, no, of each eye. Okay? So, you will lose the left and right temporal fields of vision. So, the answer is letter D. Okay? Remember your visual pathway. Okay? I-run down lang natin saglit. So, this is your eyeball, your retina. Again, the nasal part of the retina will receive the temporal half of the visual of the environment, no? Temporal field of the environment. Okay, so it will be received by your nasal part of the retina. And then same goes with your temporal part of the retina. Then the fibers in your retina will become your optic nerve. And as you see, the medial fibers of the optic nerve will cross at the optic chiasma. Okay? Then it will become your optic tract. Okay? Your lateral geniculate nucleus. And this will send information through your optic radiation here. And then eventually to your cortex. Okay? So what happens, no? If you transect here, so letter B, no? So you will lose, transect here, no? You will lose inputs from basically one eye, no? So wala kang makikita on medial and lateral fields of vision. So you lose one eye, meaning you will have blindness of one eye, no? You will have monocular blindness. Okay? If you have transected an optic nerve. Okay? What happens if you transect here, no? Sa optic chiasma. Remember, only the medial fibers, no, cross here. So yun lang yung mawawala ng inputs. And remember, the medial fibers will receive inputs from the lateral portion or temporal portion of the environment. Okay, contralateral. So again, you will lose inputs at the medial part of the retina. However, ang nakikita niya dapat is your temporal fields of vision. So you will lose eventually temporal sides of both eyes. So by temporal hemianopsia. Okay? And then remember, anything na beyond the optic chiasma, ito na lang yung tandaan nyo, it will result to a homonymous hemianopsia. Okay? Anything beyond the optic chiasma, kung ang lesion nasa optic tract, sa lateral geniculate nucleus, nasa optic radiation, o nasa cortex, same sila ng presentation. Homonymous, contralateral homonymous hemianopsia. So if I ask you, no, pag ang lesion nasa right optic radiation, so left homonymous hemianopsia. Pag ang lesion nasa left optic tract, so ang visual field defect, left optic tract, it will be right homonymous hemianopsia. Okay? Just to summarize. So pag optic nerve, monocular blindness, optic chiasma, bitemporal hemianopsia, all the rest, contralateral homonymous hemianopsia. Okay? To simplify. Ito, no, tinanong sa last exam, no? Blood supply to the inner retina, it's coming from your identification. No? It's coming from your central retinal artery. Okay? So your retina, it receives dual blood supply. Okay? It's coming from the central retinal artery, which is a branch of your ophthalmic artery. Okay? And then, the outer retina will receive choroidal circulation from posterior ciliary arteries, okay, which is also a branch of your ophthalmic artery. And the fovea, no, around 15 to 30%, no, it will receive its own blood supply coming from your cilioretinal artery, no, from your short posterior ciliary artery. Okay, but the most important, your central retinal artery. Okay. No, clinical correlations, no, about central retinal artery occlusion, no. Clinically, if nagkaroon ng blockage, they will present with unilateral loss of vision, no, RAPD. Okay? One peculiar here, your cherry red spot, no. Your cherry red spot is a manifestation of your central retinal artery occlusion. Okay? And how will you manage? Okay, you'll do ocular massage, okay, by doing finger pressure, no, about 1 minute, and then sudden release. Okay, administer aspirin and, okay, brown bagging, no, carbon inhalation. Okay, okay, next, no, punta tayo sa pharyngeal arches. Okay, So the stapes is derived from which pharyngeal arch? No, identification ulit, no, sa board exam. Okay, so the stapes is derived from which pharyngeal arch? No, 1, 2, 3, 4, 5, or 6. Okay, so the answer is, okay, second, no, pharyngeal arch. Okay, so this is your bronchial apparatus, no, your bronchial apparatus. Okay, so your bronchial apparatus, okay, you have a pharyngeal arch, pouch, and groove. Okay, you have an arch, you have a pouch, okay, and you have a groove. Okay, so your arch would be here, no? 1, 2, 3, 4, 5, no? 1, 2, 3, 4, 5. Okay, you have 5 pharyngeal arches, okay? Namely 1, 2, 3, 4, and 6, no? 1, 2, 3, 4, and 6, no? Walang 5. Huwag ka na maghanap ng 5 because it does not exist in humans, okay? So 1, 2, 3, 4, and 6 lang. Okay? Then you have a pouch, no? Your pouch is here, no? Sorry, saan yung pouch? It's here, no? 1, 2, 3, and 4. No? You only have 4 pharyngeal pouches. Okay? While your grooves is here, no? 1, 2, 3, 4 as well. So 5 pouches, 5 arches, 4 pouches, 4 grooves. Okay? And each arch, okay, will have its derivative, no? Each will contain a nerve, artery, and cartilage eventually, no, into a mature structure. Okay? Which are the following. Okay? So now, arch number 1, okay? The nerve derivative is trigeminal nerve. Okay? The trigeminal nerve. Okay? Trigeminal nerve, tinatanda ko, TM. No? Lahat ng derivative niya, TM. Okay? Tensor tympani. Letter T for trigeminal. Tensor veli palatini. Okay? Letter T also. Okay? Masticatory muscles. Letter M. No? Muscles of mastication. Trigeminal nerve. Pharyngeal arch. 1. Okay? Letter M. Mylohyoid. Okay? Mylohyoid. Sige, yun na lang. Okay, may isa pa akong mnemonic kasi, no? Kasi corny. No? Kasi si cranial nerve 5, no? Cranial nerve 5 before, no? Magkano yung Milo? Milo sachet lang, no? 5 pesos. Okay, wali. Okay? Letter M na lang. M. Okay? Mylohyoid. And next, your anterior belly of digastric. Okay? Anterior belly. Okay? Gayahin ako. Letter M sa anterior, no? Sa harap, 5, no? Sa anterior. Kasi sa likod, it's 7, no? 7. Si posterior belly, 7. Okay? Basta, memorize nyo lang. Trigeminal TM, tensor tympani, tensor veli palatini, masticatory muscles, mylohyoid, and si anterior belly of digastric. Okay? Skeletal derivatives, puro mga M, no? Your maxilla, your mandible, external auditory meatus, and your Meckel's cartilage. Okay, maxilla, mandible, meatus, Meckel's cartilage. Okay? Moving on, sa second pharyngeal arch, no, you have your facial nerve, okay, or cranial nerve 7, no? Natandaan mo, mga letter S. Okay, letter S. Okay, definitely facial nerve, no? Muscles of facial expression. Tandaan mo mga letter S. Stylohyoid, stapedius, no? Stapes, styloid, saka lesser horn of hyoid bone. Okay, lesser horn of hyoid bone. Kasi yung greater, ibang arch. Okay, and again, pag anterior ng digastric 5, sa likod, no, 7. Okay? Next, your glossopharyngeal nerve is derived from the third pharyngeal pharyngeal arch. Glossopharyngeal, pharyngeus, no? Stylopharyngeus. And muscles of deglutition. Okay, letter G, greater horn. G, greater horn of hyoid, saka body of hyoid. Okay? And your 4 and 6, no? Your 4 and 6, okay? The nerve derivative is your vagus nerve, V, no? vagus nerve. Okay? Responsible for voice, and phonation. Okay? Muscular derivatives, pharyngeal laryngeal muscles, and your laryngeal cartilages. Okay? So 4 and 6 arches. Okay, next question. Now, which of the following is not surrounded by your carotid sheath? Okay, internal jugular vein, common carotid artery, deep cervical lymph nodes, spinal accessory nerve, or none of the above. Okay, so all of them, okay, are surrounded by your carotid sheath, except your spinal accessory nerve. It should be cranial nerve 10. Cranial nerve 10, which is your vagus nerve. Okay? So your carotid sheath, it's a local condensation of your prevertebral, pretracheal, and investing layers of the deep fascia of the neck. Okay? Ang itatandaan mo lang dyan, ang context niya ay isang malaking vertical line. No? Isang malaking vertical line. Okay? Because yun yung contents niya. No? Your ICA, okay? So together it's part of its origin, your CCA. No? ICA, your common carotid artery. Okay? Sa pang vertical line for I of letter. I of IJV. No? Internal jugular vein. Sa pang malaking vertical line, no? Representing number 1 and then 0. No? Your 10th cranial nerve. No? Your 10th cranial nerve. And sa pang letter, vertical line for your letter L lang, lymph nodes. Okay, deep cervical lymph nodes. Okay, so your carotid sheath, ICA, IJV, 10th cranial nerve, lymph nodes. Okay, so ayan siya. So this is your common carotid, then your internal carotid. No? Si external carotid lalabas ng carotid sheath. Okay, this is your vagus nerve, this is your IJV, and some lymph nodes are within that sheath. This is your sheath. Yung green. Okay, next. Now, which of the following is not seen on the anterior wall of the tympanic cavity? Internal carotid, auditory tube, tensor tympani, IJV, or all of the above? Okay, sino hindi makikita sa anterior wall? Okay, that's your internal jugular vein, no? Because it's located at the inferior wall, no? Or inferior wall. Okay, so this is if you are going to take ENT, no, ORL residency, dapat memorize niyo itong picture na to, your middle ear or your tympanic cavity. Okay, so located here, okay, this is your tegmen tympani, no? That's the roof of your middle ear, tegmen tympani. Okay, the floor is here, no? Your jugular fossa. Okay, your jugular fossa. Inferiorly kasi nandyan yung internal jugular vein. Anteriorly, this is, ito yung anterior. Okay, you have your, anteriorly, ito. Okay, you have your tensor tympani. Okay, tensor tympani. You have your carotid canal for your internal carotid artery, and you have your auditory tube or your pharyngotympanic tube or your eustachian tube. Okay, then posteriorly you have your adductus ad antrum. Okay, adductus to mastoid antrum, and your pyramidal eminence. Okay, your pyramidal eminence. Okay, for which the stapedius attach. Medially, you have your promontory here. Okay, and then laterally, you have the tympanic membrane. Okay, so your tympanic membrane separates the middle ear and your external ear. Okay, so medially, it's your promontory. Laterally, your tympanic membrane. Okay, sa ano yung natanong? Your anterior wall structures. Okay, carotid canal, auditory tube, and your tensor tympani canal. Okay, and then recently, no, there's one question about your tegmen tympani, no, a thin plate of bone that separates the tympanic cavity from your meninges, no, that's your tegmen tympani. Okay, again, a thin plate of bone, no, that separates the tympanic cavity from your meninges and your middle cranial fossa, that's your tegmen tympani. Next, no, structure that crosses the Simon's triangle. Okay, your Simon's triangle, okay, is the first time na tanong, no, last 2022 or 2023, no. It's about Simon's triangle. Sorry, 2023 March. Okay, structure that crosses the Simon's triangle. Okay, wala siya sa anatomy books actually, no, sa internet siya, pero important triangle in ORL din, no, ENT surgeons, no, because it's a landmark for, or it's a space that contains this important structure. Okay, is it the trachea, external branch of the superior laryngeal nerve, the recurrent laryngeal nerve, esophagus, or common carotid artery? Okay, structure that crosses the Simon's triangle is your recurrent laryngeal nerve. Okay, so ano ba yung triangle na yan, no? Your Simon's triangle, okay, it's located here, yung red portion. Yeah. Okay, so laterally you have your common carotid artery here, no? Medially, not seen here, you have your esophagus here. Okay, superiorly you have your inferior thyroid artery. Okay, and then what do you see, no? This structure crosses your Simon's triangle, no? This is your recurrent laryngeal nerve. So if you are in this triangle, you need to be especially careful, no? Because you are about to injure, or you're about to see your recurrent laryngeal nerve. Okay? Next, no? A 27-year-old woman with a goiter comes to the hospital for surgical management. The surgeon must ligate the superior laryngeal artery before surgically resecting the goiter. So care must be taken to avoid injury to which of the following nerves. Okay? You are ligating the superior laryngeal artery. So basically, this is a recall question na ginawa niya lang case, no? Basically, the question, sinong structure yung malapit sa or in proximity to your superior laryngeal artery? Okay, that's actually your internal laryngeal nerve. Superior laryngeal artery, internal laryngeal nerve. Okay, wala siya dito. Okay, pero superior laryngeal artery with your internal laryngeal nerve. Okay, but in here, no, inferior thyroid artery naman, okay, it runs together with your, inferior thyroid, artery, it runs together with your recurrent laryngeal nerve. Okay, in here. While your superior thyroid artery, okay, runs beside your external laryngeal nerve. Okay, so sila yung partner. Superior laryngeal, internal laryngeal. Okay, superior thyroid artery, external laryngeal nerve. Okay, recurrent laryngeal nerve, okay, it runs with your inferior thyroid artery. Okay, so yan. So your external laryngeal nerve, it will supply, okay, your inferior pharyngeal constrictor, okay, pero the one that's important is your cricothyroid. Okay, it's responsible for tensing your vocal cords, no? So what happens if you inadvertently injure your external laryngeal nerve, no? So you will not be able to tense your vocal cords, no? Kasi wala kang cricothyroid. So therefore, clinical presentation is inability to register high notes. Okay? So goodbye sa singing career mo. Okay? While your recurrent laryngeal nerves, no, it supplies all intrinsic muscles of the larynx, no, except definitely your cricothyroid. Okay? Because your cricothyroid is supplied by your external laryngeal nerve. Okay? It also supplies the sensory fibers below the vocal cords. Below. Okay? So what happens if na-injure mo yung muscles of the larynx? Basically, wala kang boses, no? So you will have hoarseness. Okay? And then, your internal laryngeal nerve, okay, It supplies the sensation above the vocal cords, okay, and some taste fibers at the epiglottis. Okay? So what happens, no? If ikaw ay nag-aspirate, ikaw ay may food or may foreign body above the vocal cord, hindi mo siya ma-feel, no? Hindi ka mag-gag reflex, no? Eventually, that foreign body will enter the lungs, no? And it will cause recurrent aspiration. Okay? So, yun yung basically, this is everything about your laryngeal nerves. And tinatanong talaga. Several times. So, and dahil tinatanong siya, no? Several times, nagawa na natin siya ng mnemonic. Okay? So, ibang form ng mnemonic tayo ngayon para sa mga auditory learners. Okay? So, tayo ay kakanta. Okay? Ang hindi kumanta, sinasabi ko sa inyo, sumpa to, may -10. -10 sa board exam. Sa anatomy. Okay? So, ito, nung time kasi na madalas tinanong lumabas yung thyroid topics talaga. Sikat yung TikTok na yung 2002. Okay? So, yun yung tune natin, di ba? Yung, oops, I got 99 problems singing ba? Yan, di ba? Okay? So, ako muna, and then, ipopause mo yung video, and then, kakantahin mo. Okay? Okay? For fun. Okay? So, paano siya? Ako muna. External will supply thyroid and superior thyroid artery with me. Better hit me, baby, one more time. Inferior thyroid artery with recurrent laryngeal, singing at the top of both our lungs. Internal laryngeal, ooh, ooh. Superior laryngeal, ooh, ooh. Okay? Sige, i-pause mo, kantahin mo. Go. Okay, ano sabi dyan, no? Kinanta mo, na-memorize mo, hindi mo naman alam ibig sabihin, no? So, explain natin. Si external daw, external laryngeal nerve, no? It will supply cricothyroid, tama? Superior thyroid artery with me daw. So, sino yung magkasama? Si external laryngeal, saka si superior thyroid artery. Tama? Pasok? Balikan nga natin. O, tama, di ba? External laryngeal, superior thyroid artery with me. Si inferior thyroid artery is with recurrent laryngeal. O, tama. Ay, sorry. Balikan natin. Si superior thyroid artery with me, no? External laryngeal. So, pag na-injure mo daw siya, si external laryngeal, you better hit me, baby, one more time, no? Kasi, hindi niya ma-hit yung high notes, di ba? Inability to register high notes. While si inferior thyroid artery, it's coming with your inferior recurrent laryngeal, you need to sing at the top of your lungs kasi wala kang boses. Hoarseness, no? Hoarseness ang presentation. Di ba? Okay, and then si internal laryngeal nerve, superior laryngeal artery, yung partner niya. Okay? Ano ibig sabihin ng nauubo siya kasi nag-aspirate, no? Kasi pag na-injure, recurrent aspiration. Okay? Sige. Kantahin mo. Okay, pasok, di ba? So next, moving forward, kung ayaw, wag i-memorize. So, which of the following is true regarding the thyroid and parathyroid glands? In the recent years, laging may comparison sa mga glands, sa lahat ng mga structure in the body. Mahilig mag-compare yung examiner ngayon. So, right, no? Jejunum versus ileum, small intestine versus large intestine, no? Ito, thyroid versus parathyroid. Ganyang, right versus left lang, no? O kaya, right bronchus versus the left bronchus. Mga ganyang questions. So, ito lumabas din to. About your thyroid versus parathyroid glands. Okay? Letter A, is it correct? The parathyroid glands are brownish red, tiny ovoid bodies, no, attached to the posterior surface of your thyroid gland. Okay? Tama ba? Brownish red ba sila? Letter B, the thyroid gland and your inferior parathyroid glands originate from the third pharyngeal pouch. Letter C, the thyroid and parathyroid glands share the same blood supply and lymphatic drainage. Letter D, all of the choices are correct. Okay, ang correct lang dyan ay letter C, no? Bakit mali yung B? It must be the thymus. The thymus in your inferior parathyroid gland, no? Share the same origin from the third pharyngeal pouch. Okay, your parathyroid are yellowish brown. Okay, brownish red yung thyroid gland. Okay, so sinamarize na natin dyan in one table. So you only have one thyroid gland while you have two pairs of parathyroid. Okay? In terms of color, brownish red, pear shape, butterfly shape si thyroid. Your parathyroid is yellowish, tiny ovoid bodies. Okay? Your thyroid gland, you can see it in front of the trachea. Okay? And will secrete T3, T4, okay, and calcitonin. Okay? T3, T4, and calcitonin. It is derived from endoderm, your thyroid primordium. Okay? Thyroid primordium. While your parathyroid gland, okay, is located in the posterior surface of the thyroid gland. Okay? It will secrete PTH, okay? And it's derived from your third and fourth pharyngeal pouches. Okay? Third and fourth pharyngeal pouches. Meron ako mnemonic dyan, no? TIFs. No? TIFs. Okay? Your third, okay, inferior parathyroid. Your fourth, superior parathyroid. Okay? TIFs. And as you see, arterial supply, venous drainage, lymphatic drainage, innervation are the same. Okay? O, question. Ito, lumabas to. Okay? What cells secrete calcitonin? O, 2023 exam. Okay? What cells secrete calcitonin? Ayan na, no? Your parafollicular cells or your C cells. Okay? From your thyroid. Okay, wag mo nakalimutan, ha? Calcitonin, recently lang lumabas. Okay? Coming from parafollicular or C cells. Ito pa, 2019 naman lumabas. Okay? This artery, no, is not always present. Okay, this artery is not always present. Artery that supplies kulang yung question. The artery that supplies the thyroid gland, no, which is not always present. Ganun yung tanong. Okay, not always present, no, pala absent. Okay, thyroidea ima artery. Okay, thyroidea ima artery. Artery that is not always present. Okay, next. Now, which artery is not included in your Kisselback area? Okay, your Kisselback area. Sa plexus in your nose, okay? Sphenopalatine, greater palatine, inferior labial, superior labial, or anterior ethmoidal. Okay? So, lahat sila ay contributor ng Kisselback area, no? Except your inferior labial artery, no? Ang mali lang dyan, dapat siya ay superior labial artery. Okay? Okay, clinical correlation yan, no? Kasi, no, in epistaxis, this is the area injured, no? This is the area injured, your Kisselback's plexus or your Kisselback's area. It's located in the anterior part of the nasal septum, okay? Kisselback's plexus or area, located in the anterior part of the nasal septum. Okay, it's important because it's a site of anastomosis of the arterial plexus in your nose, no? And that includes your sphenopalatine, greater palatine, okay, originating from maxillary, your anterior and posterior ethmoidal arteries from your ophthalmic artery, and your superior labial artery, no, from your facial artery. Okay? Anong most common cause ng epistaxis? No? Nose picking, trauma sa mga bata. Okay? Infection, mga urti. Okay, and super high blood pressure, hypertension can cause epistaxis. Okay, the treatment would be compression lang, no? Packing. Okay, so this is your Kisselback's plexus or area. Okay, in here, no? Sphenopalatine, anterior posterior ethmoidal, superior labial. Okay, greater palatine as well. Okay, done with the head and neck. Okay, moving downwards to your thorax. Okay? Ribs that articulate with the manubrium. Identification ulit, no? Support exam. First and second. Okay? Yun lang. O, yun lang. Manubrium ito, no? Okay? So, nag-articulate si first, ito, and part of your second. Okay? Okay, ito, important, topics din, no? Mga arrangement ng mga vein, artery, nerve, and other structures, no? Iba-iba kasi meron kong mga iba-ibang systems, no? Different arrangement. Okay? First, sa intercostal structures, okay? You have a vein, artery, and nerve. Okay? Vein, artery, and nerve. So, that's from superior to inferior. Okay? Ang mnemonic natin is VAN. In here, no? VAN. Vein, artery, and nerve from superior to inferior, no? Located in your intercostal groove. Vein, intercostal vein, intercostal artery, intercostal nerve. Okay? Yan sila sa ilalim. That's why, if tutusok ka for thoracentesis, you tusok at above, no? Above the rib. Okay? Those are intercostal structures. Okay? In your kidneys naman, no? At the renal hilum, okay? This is arranged naman from anterior to posterior, no? Ano naman, ang mnemonic is VAWA. Okay? VAWA. Okay? It's vein, artery, okay? The ureter, artery again. Okay? Vein, artery, okay? The ureter, pelvis to ureter, and then another artery, no? VAWA. And then, sa hilum of the lungs, it's different ulit, no? Kasi bronchus naman. Ang mnemonic naman is, again, from anterior to posterior, VAB. Okay? This is your pulmonary vein, okay? Pulmonary artery, and then your bronchus. Okay? Vein, artery, bronchus. VAB. Okay? Okay. Next, no? The sternal angle of Lewis is an important surface landmark and lies at the level of third costal cartilage. Is that correct? Is it at the level of T1, T2, IV disc? Is it at the junction of aortic arch and the descending aorta? Okay. Is it at the beginning of the ascending aorta? Or letter E, no? Both C and D. Okay, so the correct answer here is correction, letter C, no? Letter C. Junction of the ascending letter C, no? Junction of the aortic arch and the descending aorta. Okay, it's actually the end of the ascending aorta, no? Malita. So, this is your sternal angle of Lewis. No? Kailangan mo siyang tandaan kasi ang dami nangyayari dyan. Okay? Number 1. Okay, so sternal angle. This is where your second costal cartilage attaches. Okay? It's at the level of the second costal cartilage. Okay? Next. Moving posteriorly, ayan, no? This is your aorta, the red ones, no? It marks the end of the ascending aorta. And it's the beginning of the arch of the aorta. Okay? End of the ascending, beginning of the arch of the aorta. Okay? It also demarcates the end of the ascending aorta. Okay? End of the arch of the aorta. So your arch of the aorta, it begins and ends at the sternal angle of Lewis, at the level of sternal angle of Lewis. And then, it demarcates the beginning naman of your descending aorta. Okay? It also demarcates the bifurcation of the trachea. Okay? Bifurcation of the trachea. Okay? And it happens to be just at the level of T4, T5 IV disc. T4, T5 IV disc. Okay? And lastly, okay, at the level of the sternal angle, no, when you make a plane there, okay, that would be your transverse thoracic plane, no, to divide your superior mediastinum and inferior mediastinum. Okay, basically yan, no? Okay, dahil marami nang nangyari dyan, okay, kantahin ulit natin. Okay, kanta lang to, no? Pero kung gusto mong sayawin, go. Okay? If naalala, sumikat na naman sa TikTok yung ano, no? Sayaw Kikay, no? Nung mga few years ago, no? Sayaw Kikay. Ang mnemonic naman natin dito, sayaw T5, no? Sayaw T5. Silent T4 na lang, na hindi natin siya babanggitan. Pero basically, lahat ito refers to T4, T5, no? T4, T5, transverse thoracic plane, sternal angle of Lewis. Okay? So, paano yun? Diba? La, 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 la. So, ang gagawin mo lang dito, sasagot ka lang ng T5, no? Yun na lang yung hinihingi ko sa'yo. Sasagot ka lang ng T5. Okay? So, la, 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 la. Level ng second rib ay T5. Intervertebral disc ay T5. Transverse thoracic plane ay T5. Okay? La, la, second paragraph. La, 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 la. Okay? Sorry, malito ha. Ang end ng ascending ay T5. Ang start ng descending ay T5. Bifurcate ang trachea ay T5. La, 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 la. Okay? So, la, 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 la. And so on. Okay? Tama, no? Second rib daw, T4, T5. IV disc, T4, T5. Okay? Yung transverse thoracic plane, T4, T5. Lahat yan. Sorry, it's end of the ascending, no? End ng ascending, T5. Ang start ng descending, T5. Okay? Bifurcation of the trachea, T4, T5. Okay? Did you get it? Yes. So, to the heart na tayo, no? Natanong din recently ang borders of the heart on X-ray. Okay? So, this is your heart, no? Okay? At the right acute border, okay? You have the right atrium, right somewhere here, no? And then your SVC and IVC. Okay? Your left obtuse border, here, no? You have your left auricle and the left ventricle. Okay? Inferiorly, you have your right ventricle. Okay? And at the apex, you have your left ventricle. Okay? Favorite question then, ang blood supply of the heart. Okay? So, your blood supply, they come from the ascending aorta. Okay? Blood supply of the heart is coming from your ascending aorta. And is filled with blood during diastole. Okay? It's filled with blood during diastole. Okay? Starting with your right coronary artery. Your right coronary artery, so it arises from your anterior aortic sinus. Okay? Of the ascending aorta. Sabi nga natin. It runs between the pulmonary trunk and right auricle. Okay, and descends in the right coronary sulcus. Okay, so your right coronary artery is here. Okay, so branches. Okay, you have the right conus artery. It will supply the pulmonary conus. You have ventricular branches, anterior and posterior ventricular branches. Pero ito yung mga important branches niya. You have the posterior descending artery. Okay, posterior descending artery. Coming from your right coronary artery. No? Majority. It will supply the right and left ventricles in the posterior part of the ventricular septum. Okay, and you have atrial branches. Okay, to supply the SA node, right and left atria. Okay, so board's question again. Which of the following arteries will supply both ventricles? Okay, so ang sagot, posterior interventricular or posterior descending artery. Okay? Another board's question. Which of the following nerves will supply, following arteries will supply your SA node? No? Which of the following arteries will supply your SA node? Okay, it will come from your SA nodal artery, no? Which is a branch of right coronary artery. Okay, which is a branch of your right coronary artery. Yeah, no? Next, your left coronary artery, okay, it arises from the left aortic sinus, ascending aorta again. Usually, it's larger and shorter and supplies majority of your heart. Okay, this is your left coronary artery. So you have two branches. Now you have your left anterior descending artery and you have your circumflex artery here. Okay, so your left anterior descending, it also supplies both ventricles. Okay, it supplies both ventricles and anterior half of the ventricular septum. Okay, your left circumflex will supply the left side of the heart, left atrium, left ventricle. Okay, next, board's question again. Okay, which of the following arteries, okay, is known as your widow maker, no? Widow maker of the, which of the following arteries is known as your widow maker? No? It's your left anterior descending artery. No? Pag kasi yan ang tamaan, no? Usually, kinamamatay. Nagiging widow. Okay, next, no? Going to the venous drainage of the heart. A heart failure patient was evaluated to have blockage of the coronary sinus. So, which of the following veins would be least likely affected? Okay, great middle small cardiac veins, oblique vein of the left atrium, posterior vein of the left ventricle, or your azygos vein. Okay? So, basically, ang question na to, sino daw yung hindi nagde-drain sa coronary sinus? No? So, to simplify. Okay? All of them will supply, will drain to the coronary sinus except for your azygos vein. Okay? Because your azygos vein will drain directly to the right atrium. Okay? So, your coronary sinus is the largest vein draining the heart. Okay? It lies in the coronary sulcus and opens into the right atrium, no, between the IVC and the AV opening. Okay, it will receive blood from your great middle and small cardiac veins, from the oblique vein of the left atrium and the posterior vein of the left ventricle. Okay, so this is your coronary sinus. Yeah, coronary sinus in the coronary sulcus. Okay, next question, no? Still about the veins, no? To improve the blood flow to the interventricular septum, a coronary bypass procedure is elected. During surgery, the anterior interventricular artery is located and prepared to receive a graft. The vessel lying adjacent to the anterior ventricular artery is, no? So to simplify, sino lang yung katabi ni anterior ventricular artery? Great cardiac vein, middle cardiac vein, anterior cardiac vein, small cardiac vein. Okay? Answer, sinong katabi niya? No? Just a recall question, your great cardiac vein. Okay? So, kaka-partner, no? Si great cardiac vein, okay? Okay? It lies beside your anterior interventricular artery. Okay? Your middle cardiac vein, on the other hand, it's beside your posterior interventricular artery. Okay? While your small cardiac vein, okay, it lies beside your right marginal artery. So far, wala akong mnemonic dito, no? Pasensya ka na. Pero mga tatlong board exam na to tinanong, no? If may suggestion kayo, no, PM nyo. Kasama natin sa mga next, exam, next review. Okay, next, the moderator band is seen where, no? Sa heart, okay? Right atrium, right ventricle, left atrium, left ventricle. Okay. Okay, ang sagot ay nasaan lang siya? Nasa right ventricle. No, ang mnemonic ko diyan, tinanong actually ito na 2023, recent lang ha. Moderator band ventricle. Okay, moderator ventricle, no? Kasi right ventricle, nandun si moderator band. Okay, so ng mga peculiarities in each part of the heart, each chamber of the heart. Okay. Let's start with the similarities muna. Both atrium will have an auricle and pectinate muscle. Okay, both atrium will have an auricle and a pectinate muscle. So, but what's other feature? Your sulcus terminalis externally and your crista terminalis internally, no? There's a ridge in your right atrium. Yeah, no? It's located in your right atrium. Okay? The ridge externally and internally. Sulcus is external. Crista is internal. Okay? It's located in your right atrium. Tinanong na both, no? Tinanong na yan both. External ridge, sulcus terminalis. Internal ridge, crista terminalis. Okay, and you have your fossa ovalis and your annulus ovalis. Okay, both of them, no, remnant of your foramen ovale. Okay, it's located in your right atrium as well. Okay, next, okay, trabeculae carneae, papillary muscle, and chordae tendinae, no, it's a unit naman, ha? Trabeculae carneae, papillary muscle, and chordae tendinae. Okay, para coordinated yung contraction, no, ng valves and your muscles. Parehas meron ang ventricles, no? Trabeculae carneae, papillary muscles, chordae tendinae, seen on both ventricles. Okay? However, your moderator ventricle, no? Moderator band is in your right ventricle. Okay? So your infundibulum, it goes to your pulmonary conus, no? It's in your right ventricle. Okay, and then your left ventricle will drain to your aorta. No? Kaya nandun yung aortic vestibule. Next, the triangle of Koch is anatomically significant because its apex contains the sinoatrial node, AV node, bundle of His, coronary sinus orifice, or tendon of Todaro. No? So your triangle of Koch, is it contains your AV node. Okay, so ano ba yan, no? This is your tendon of Todaro. This is your triangle of Koch. Okay, first you have your coronary sinus orifice here. Okay, then your right AV valve septal leaflet. Okay, it's here. Okay, and then the tendon of Todaro, no, forming a triangle. Okay, and then what's the clinical important structure here, no? You have your AVN at its apex, no? So yun yung importance and triangle of Koch. Okay, yun lang. Next, pain from an infection of the pericardium is carried in the vagus nerve, phrenic nerve, medial cutaneous nerve of the arm, or intercostobrachial nerve. Okay, so pain from the pericardium, it is being carried by your phrenic nerve. Okay, so remember your phrenic nerve, it arises from 3, 4, 5 cervical spinal nerves, no? Remember, no, your 3, 4, 5 keeps the diaphragm alive, diba? Your phrenic nerve, 3, 4, 5 keeps the diaphragm alive. However, but in terms of sensation, no, ito yung mga sinusupply niya. The central region of the undersurface of the diaphragm, okay, it supplies the pleura as well and the pericardium. Okay, that's why when you have pain coming from pericarditis, okay, it is being carried out by your phrenic nerve. Okay, for phrenic nerve. Okay, versus an anginal pain, no, the pain is coming from the medial cutaneous nerve of the arm, diba? Usually nagra-radiate dito, okay, yung anginal pain. Okay, it is served by your medial cutaneous nerve of the arm. Okay, more questions, no, about the heart, no? Tinatanong pa din, okay? Recently, 2023 yung last exam lang, no? Location of the valves, auscultation of the valves. Okay? Remember, the location is different from auscultation. Location kung nasan siya, okay? Auscultation, where the heart sounds is best heard, okay? So magkaiba yung location and auscultation. So your tricuspid valve, it's located in the 4th ICS right. Okay? Bicuspid valve, it's in the 4th costal cartilage left. Pulmonary valve in your 3rd costal cartilage left. Okay? While your aortic valve is in your 3rd ICS left. Okay? Look at this table again, no?
Aortic, third ICS left. Pulmonary, third costal cartilage left. Mitral, fourth costal cartilage left. Tricuspid, fourth ICS right. Okay? Pero in terms of auscultation, no, it's here, no? Aortic valve, it's in the second ICS right. Okay? Pulmonary valve, it's in the second ICS left. Okay? Mitral valve, it's in your fifth ICS left as well. Okay? In your tricuspid valve, it's in the left lower sternal border. Okay? Yung auscultation. Okay? So as you see, hindi ka mag-auscultate sa costal cartilage. Wala ka maririnig doon, no? So, lahat na auscultation, lahat nasa intercostal space. Okay? So, yan yon. Okay? And there were questions about the cusps of the valves, no? Okay, isa-isahin natin. Your tricuspid valve has 3, no? Tama naman. Kaya nga siya tricuspid girl, no? Tricuspid valve, 3 cusps, no? Anterior, septal, and inferior cusp. Okay? Your bicuspid, dalawa, no? You have an anterior and a posterior. Okay? Your pulmonary valve, you have 1 posterior or left cusp. Okay? And you have 2 anterior cusp, no? Namely, anterior and right, no? Gulo-gulo nila magpakalan, di ba? And then, you have 3 aortic cusp. You have 1 anterior, you have 2 posterior. Okay, so basically, all of the valves have 3 cusps except for bicuspid valve. Okay, what you need to remember here, you need to memorize the name of the cusp. No? Kasi yun yung lumalabas. Okay, main names. No? Yung anterior, posterior, left, or right. Yan, no? So, yan siya. Okay, ito, no? Tricuspid, 1, 2, 3. Okay, this is your aortic, 1, 2, 3. Pulmonary, 1, 2, 3. Okay, bicuspid, yung parang cervix, no? Dalawa lang. Okay, now, we're done with the heart. So, let's now move on to your lungs. Okay, starting with this question. Which of the following is not true about the main bronchus? Okay, letter A. The right principal or main bronchus is wider, shorter, and more vertical than the left. Letter B. Before entering the hilum of the right lung, the principal bronchus gives off the superior lobar bronchus. Okay, tama ba yon? Letter C. The right principal bronchus is narrower, longer, and more horizontal than the right. Okay, magaling statement niya. No? And then letter D. The left main bronchus passes to the left below the arch of the aorta and in front of the esophagus. Okay? So, not true. Okay, letter A is correct. No? It's wider, shorter, and more vertical. Letter B is also correct. No? Magbibigay muna siya ng superior lobar bronchus. Okay? Letter C is incorrect. No? It should be left. No? The left main bronchus is narrower, longer, and more horizontal than the right. Okay? So, letter D is also correct. So, the answer here is letter C. So, comparing your right main bronchus versus your left main bronchus. No? It's in this table. Okay? Right main bronchus is wider, shorter, and more vertical. Okay? Wider, shorter, more vertical than the right. While your left is narrower, longer, and more horizontal. Okay? Basically the opposite. So, how do I remember, no? You do this, no? Your thumb reflects your right main bronchus. Your index finger is your left main bronchus, no? Nakaganyan, no? So, your thumb is wider, tama? It's shorter and more vertical when you do this. Your left main bronchus is narrower, longer, and more horizontal. Okay? Next, your right main bronchus, okay, gives off an eparterial bronchus. Okay? It gives off an eparterial bronchus, okay? Ibig sabihin nun, before it enters the hilum, magbibigay na siya ng isang bronchus, no? Superior lobar bronchus. And then, upon entering the hilum, okay, it will now give off the middle and the inferior lobar bronchus. Okay, these are your hyparterial naman. Okay? Okay, and it runs under the arch of the azygos vein. Okay? That's why, pag merong tumor sa right main bronchus, no, it can immediately compress your azygos vein. No? Question yan. BRS question. Next. Your left main bronchus, it passes below the arch of the aorta and in front of the esophagus. Ang issue, no, your left main bronchus, okay, pagpasok niya pa lang sa lung, doon pa lang siya magde-divide into a superior and inferior lobar bronchus. Okay? Let's look here, no? This is your right main bronchus, no? This is your azygos vein, no? It's shorter, wider, and more vertical. Okay? Look here, no? This is your left main bronchus. It's longer, it's more horizontal, and it's narrower. It lies in front of esophagus and under your arch of the aorta. Okay? So, those are the differences between your right and left main bronchus. Okay? Let's now differentiate naman your right and left lung. Your right lung, it's larger, heavier, shorter, wider. Okay? It's larger, heavier, shorter, wider. Okay? Why such? No? Because mas mabigat siya, mas malaki siya kasi mas marami siyang lobe. It has 3 lobes. Okay? Upper, middle, and lower lobes. Okay? And because it has 3 lobes, okay, it has 2 fissures that divides it, no? So, kung hatiin natin sa tatlo, no? Dapat may dalawang fissure ka dyan, no? Namely, your horizontal fissure and your oblique fissure. Okay? Your right lung has 10 bronchopulmonary segments, no? And it has grooves for SVC, arch of the azygos vein, in your esophagus. Okay? While next, no, your lingula, okay, is located in your left lung. Okay? Also your cardiac notch. Okay? Tinanong na both, no? Lingula is located in which lung? Left lung. Cardiac notch is a feature of which lung? Left lung ulit. Okay? It only contains 2 lobes, so upper and lower lobe. Okay? And divided by the oblique fissure. Okay? Different references says it's 8. It has 8 segments. Okay? Some says it has 10 segments. Okay? Wala namang issue. Kasi hindi tinatanong. Okay? It has grooves for aortic arch, descending aorta, and left subclavian artery. No? So as you see, no, pag arterial side, no, nandun sila sa left lung, no? Artery yan, di ba? No? Aorta, subclavian artery. Venous side is located in the right, no? Right lung. Okay? SVC, azygos vein. Okay? So try to answer this question. Which of the following is not true regarding the differences between the right and left lung? Tama ba si right lung larger and heavier? Yes. No? Tama ba right lung divided into upper, middle, and lower? Yes. Tama ba si C? Walang horizontal fissure sa left lung? Yes. No? Kasi dalawa lang yung lobes niya and it is divided by the oblique fissure. Tama ba si D? Left lung has a groove for the aortic arch. Aorta, arterial, left. Tama, no? Anong mali sa D? Letter E. No, it should be the right lung, no? The right lung is shorter and wider. Okay? There were several questions then about your bronchopulmonary segment, no? Recently lang din to, 2023 din to. Okay? So your bronchopulmonary segment, okay, is the anatomical, functional, and surgical unit of the lung. Okay? It's a subdivision of the lobe. It's pyramid shape. Okay? And the apex is towards the lung root. Okay? Your apex is towards the lung root. It is surrounded by the connective tissue. Okay? And each bronchopulmonary segment will contain a segmental bronchus, okay, a segmental artery, lymph vessels, and autonomic nerves. Okay. Okay, meron siyang sariling bronchus, artery, nerves, and lymph vessels, no? Pero wala siyang segmental vein, no? Because the segmental veins are located in the connective tissue between bronchopulmonary segments. Okay? It is a surgical unit because one disease segment can be removed surgically, no? Segmentectomy. Again, segmental vein wala sa bronchopulmonary segment. Okay? Sabi natin kanina, right lung has 10, left lung has 8 to 10. Okay? Pero 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yan. Ito, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No? Dito in this table, 10 sila both. Okay? Anong differences? Similarities pala muna. Okay? Inferior lobe, walang issue. Okay? Superior, medial basal, anterior basal, lateral basal, okay, posterior basal, same. Okay? Remember, your right lung, siya lang yung may middle lobe. Okay? Your middle lobe is divided into two pa. Your lateral and your medial bronchopulmonary segments of the middle lobe. Okay? Sa right lung, you have an apical, posterior, and anterior segments of the superior lobe. Okay? Ito na yung issue, no? Sa left lung, okay, you have apical, posterior, anterior. Sometimes your lingula is divided into two, superior lingula and inferior lingula. Okay? However, in some references, okay, isa lang yung lingula, okay, and then ginagawa nilang apico, posterior. No? So that would be 1, 2, 3, no? Plus 5 magiging 8, no? So yun yung issue, no, sa different references. Anyway, hindi naman tinatanong. Okay? So there was one board exam din, no? Parang mga 2022, no? Nagtanong about types of cells in the lungs, no? And each cell, one question for each, no? So kung naaral mo yun, bongga, no? Nasagot mo lahat. 3 rin yun. Okay? So, daanan natin silang lahat. Okay? But first, this question, no? Which of the following is true about the cells of the lungs? A. The main role of type 2 pneumocyte is to provide a barrier of minimal thickness that is readily permeable to gas. Is it correct? Okay? It's not correct, no? It should be type 1. Letter B. Type 1 pneumocyte contains lamellar bodies. Okay? Incorrect also. It should be type 2. Okay? Letter C. Clara cells are able to divide, differentiate, and replace other damaged cell type. Okay? It's correct. Okay? That's actually the correct answer. Letter D is incorrect. No? Type 1 pneumocytes are large rounded cells that secrete surface active material. No? Type 2 dapat. No? The one that secretes surfactant is your type 2 pneumocytes. Okay? Let's start first with Clara cells. No? These are non-ciliated cells in the epithelium. Usually, you see them in the most distal part of the respiratory bronchioles. Okay? And has 3 functions. Number 1, it also secretes components of your surfactant. Okay? They function as stem cells, no? Because they can divide, differentiate, and replace other cell types. Okay? And meron silang own cytochrome P450 system, no? Which acts to detoxify noxious substances. Okay? So those are the function of your Clara cells. Okay? Your type 1 pneumocytes, okay, other names nandyan, alveolar lining cells, type 1 alveolar cells, or squamous alveolar cells. So these are squamous cells with flat nuclei. Okay, and they comprise around 95 to 97% ng alveolar surface. And this is where your gas exchange occurs, no? At the type 1 pneumocytes. Okay, ayan siya, no? Type 1 pneumocyte, flat squamous cells. Your type 2 pneumocytes, on the other hand, okay, these are large rounded cells which has large and plump nuclei. Okay, and plentiful cytoplasm. It comprises around 5% of the total alveolar surface area. Okay, these structures contain your lamellar bodies, no, which contains naman the surface active material, no, which is your surfactant. Okay, so basically your type 2 pneumocytes secrete your surfactant. Okay, so that's type 1, type 2 pneumocytes, and your Clara cells. Okay, lahat sila na tanong. Okay, going to the abdomen. Okay, starting here, no? The esophagus enters the esophageal opening of the diaphragm at the level of T10 together with your vagus nerve. Is it at the T8 together with your phrenic nerve? Is it at the level of T10 together with your thoracic duct? Is it together with your T10? It's at the T10 ba? Together with your azygos vein? Or at T12 with the right vagus nerve? Okay, so remember your mnemonic CEA, no? CEA A1012, no? Ang tanong dito, si E, no? Esophageal, it's at T10. Tama? So eliminate B, eliminate E. But the question here, sino ang kasama niya dyan, no? So it enters the esophageal opening together with nerve supply, no? Which is your left vagus nerve. Okay? So again, no? CEA 8, 10, 12. Caval opening T8, esophageal opening T10, aortic opening T12. Okay? So caval opening for your inferior vena cava, okay? Together with your right phrenic nerve. Okay? The esophageal opening, the level of T10, definitely the structure that will enter here will be your esophagus together with its nerve and blood supply. Okay? Your vagus nerve, left gastric vessels, and your lymphatic vessels. While your aortic opening, it's at the level of T12. Okay? It allows passage of your aorta, thoracic duct, and your azygos vein. Okay, that's all. Okay, next. Specialized lymphoid tissues are seen in what part of the GI tract? Okay, so it refers actually to your Peyer's patches. Okay, so your Peyer's patches are located in or is peculiar feature of your ileum. Okay, so yan na naman, no? Jejunum versus ileum. Okay, so your jejunum, it comprises the proximal 2/5 of your jejuno-ileal complex, located in the upper part of the peritoneal cavity below the left side of the transverse mesocolon. Okay, it is emptier, it is larger, it has thick walls, and redder. Okay, number one, it is redder because it has a better vascularity. Okay, compared to your ileum. Bakit siya better vascularity? Because it has thicker walls, no? More muscular, more vascular. Okay? And then, mas muscular siya in larger diameter and emptier. Why, no? Yung muscles mo dito, okay, ang function ng jejunum ay ipasa yung trabaho sa ileum, no? Parang yung co-intern mo dati. Okay? Ang trabaho niya lang ay magpasa ng magpasa. So contract lang siya ng contract, no? Kaya makapalang muscle layer niya, okay? And then malaki siya, okay? Dahil contract siya ng contract, no? Laging wala siyang laman, no? Mas emptier siya. Okay? So that's your jejunum. Okay? So your jejunum ay yung part ng intestine mo na panglamang. Okay? So, your plicae circularis, okay, are larger, taller, and more numerous. Okay? So, going to the more microscopic. It has less arterial arcades, 1 to 2 only. Okay? And then dahil less yung arcades niya, okay, the vasa recta needs to be longer, no, para makarating siya sa susuplayan niya. Okay? It has scanty fat deposition and no Peyer's patches. Okay? Kamaya yung picture. Your ileum, distal 3/5, okay, it occupies the lower part of the peritoneal cavity. Okay? The pelvis as well as your right lower quadrant. Okay? Your plicae circularis is shorter, widely separated. Okay? It has more arterial arcades and shorter vasa recta. Okay? More fat and contains the specialized lymphoid tissue. Okay? Which is your Peyer's patches. Okay? So this is your jejunum. Okay? This is your ileum. Okay? Oh. Itsura pa lang, sinong mas madilaw, sinong mas mataba. Okay? Ileum. Okay? And then, yung parang may mga tigyawat dyan, no? Yun yung mga, lymphoid tissues. And then, pag nag-aggregate siya, okay, ayan, no? That's your Peyer's patches. Okay? You can only see it in your ileum. Ano pa? Look at the blood vessels, no? This is your arterial arcade. Dito, no? Isa lang. Look here, no? Isa, dalawa, tatlo, ang dami, no? Maraming arterial arcades. Ang ileum, no? More arterial arcades, ileum. Okay? This is your vasa recta. Okay? Mas mahaba ang vasa recta ng jejunum, no? This is the vasa recta of your ileum. May iikli lang. Kasi, marami siyang arterial arcades. You look at the plicae circularis. Sino mas kulubot? No? Your plicae circularis is more prominent in your jejunum. Okay? And tingnan nyo yung mas mataba. No? Sino mas mataba? It's your jejunum as well. Okay? So essentially, yun yung table na ito. Next. Okay? Jejunum versus ileum, tapos na. Let's go larger scale, no? Small versus large intestine. Okay? Your small intestine is more mobile and has a mesentery, no? While your large intestine is generally fixed and retroperitoneal. Okay? With some exceptions. Definitely your small intestine has a smaller diameter, no? It has a smaller diameter. Okay, compared to your large intestines. And then, one external feature of your large intestine is your teniae coli. No? You have 3 longitudinal muscle bands. You can see externally. Okay, you also have fatty tags known as your appendices epiploaceae. Okay, and your sacculated walls. Okay, ayan. No? This is your large intestines. Yung mga taba-taba dyan, no? Those are your appendices epiploaceae. No? Itong lining, this is your longitudinal bands. No? Yan. Okay? Yung parang longganisa dyan, no? That's your sacculations or sacculated walls or your hostra. Okay? Hostra. Okay? So, appendices epiploaceae, longitudinal bands, and hostra are all features of your large intestine. Okay, histologically, okay, plicae circularis, okay, you can only see that in your small intestine. Okay, also your Peyer's patches and your villi. Okay, as well as your Paneth cells. Okay, and then your large intestines, mas prominent ang crypts of Libercon, and it has more goblet cells. Okay. So, to summarize, isa na lang yung i-memorize natin. Okay? Let's memorize the large intestines. Okay? Ano sabi dyan? Okay? Ang mnemonic natin is large, no? Large. Okay? Ano mga features about your large intestine? Your Libercon crypts, okay, is deeper, no? In your large intestines. Your appendices epiploaceae, no? Your fatty tags is only seen in your large intestine. Your hostra, no? Hostra for letter R, no? Your hostrations, sacculated walls, okay, is a feature of your large intestines. Goblet cells and external longitudinal bands, okay, are all features of your large intestines. Okay, so that's for your small and large intestines. Okay, next. Ulceration at the posterior wall of the first part of the duodenum may erode which vessel? Okay, ang dami talaga identification sa board exam. So, first part of the duodenum, no, pag nag-ulcerate sa posterior wall, ma-erode siya, no, kasi nandun siya sa likod. No? Bakit kasi dun ka dumadaan? Kasi through the duodenal artery. Okay? Similar question. Which of the following arteries is most likely eroded in perforation of peptic ulcer disease? Okay? Also your gastroduodenal artery. Okay? So this is your duodenum. This is your stomach. Okay? And apparently your at the posterior part of your gastroduodenal junction, nandun yung gastroduodenal artery, no? So, if you have ulcers, no, at this portion, most likely it will erode your gastroduodenal artery. Okay? Next, now blood supply to the fundus of the stomach originates from, okay, your fundus of the stomach is supplied by the short gastric arteries. Okay, short gastric arteries, no? Pero wala siya sa choices. And your short gastric arteries originates from your, okay, splenic artery. Okay, ayan, no? Itong table na to. Diagram na to, no? Memorize it by heart. Okay? Walang kanta-kanta dito. So, from your aorta, you have 3 anterior visceral branches. Okay? Celiac artery, superior mesenteric artery, and your inferior mesenteric artery. Okay? Start muna tayo dito sa madali. Inferior mesenteric artery, LSS. No? Inferior mesenteric artery, LSS. Left colic, sigmoid artery, and your superior rectal artery. Okay? Left colic, sigmoid artery, superior rectal artery. Next, superior mesenteric artery. Okay? Ang mnemonic is GMRI. Okay? Jejunal artery, iliac artery, inferior pancreatico-duodenal artery, middle colic artery, right colic, and your ileocolic artery. Okay? So, one board's question, your appendix receives its blood supply from your appendicular artery, which is a branch of your posterior cecal artery, okay? A branch of your ileocolic, okay? And the main supply is your superior mesenteric artery. Okay? So, yun yung path ng arterial supply of your appendix. Okay? Next, no? Your celiac artery is divided into left gastric, splenic, and hepatic artery. Okay? Your left gastric is the largest artery. Largest branch of your celiac artery. Okay? And then, wala siyang branch. Okay? Thank God. Walang branches si left gastric. Si splenic artery, okay, ang important lang dyan is lahat. Your splenic artery, important lahat. Short gastric arteries, no, which will supply your fundus of the stomach. Okay, you have your splenic arteries proper and left gastroepiploic artery. We'll discuss later. Your hepatic artery, no, has several branches. Your cystic artery, right gastric, gastroduodenal, right hepatic, and left hepatic artery. Okay, and your gastroduodenal further subdivides into right gastroepiploic and superior pancreatico-duodenal artery. So, maraming questions about the blood supply of the stomach. And yung isa nga, no, the one that supplies the fundus of the stomach is here. Ayan, no? It's coming from your short gastric arteries, no, which originates here. Ano to, no? Your splenic artery. Okay? Next, no? Remember the parts of your stomach. You have the lesser curvature. You have the greater curvature. Okay? So, sa lesser curvature, okay, ang tandaan dito, pag left, lagi siyang upper half. Pag left, upper half. Pag left, upper half ang sinusuplayan niya. Okay? And then, so in here, the upper half of your lesser curvature, okay, is supplied by your left gastric. Okay? While the lower half is supplied by your right gastric. Tama? No? Upper half si left, lower half si right. Okay, next. Si greater curvature, in here, ito, upper half, left pa din, di ba? Left gastroepiploic artery. Okay? While the lower half is supplied by your right gastroepiploic artery. Okay? So, yun na yung supply ng stomach. Okay? Paano matatandaan? Kasi 'di ba? Okay na tayo. Left sa taas. Okay? Pero malilito ka kung gastric ba o gastroepiploic. Okay? Gastroepiploic, it supplies the greater curvature, okay? Because it has greater number of letters. Mas marami siyang letters, 'di ba? Gastroepiploic mas maraming letters. Pag gastric, lesser letters. So sa lesser curvature. Okay? Simple. So, yun. Next. Ito, question to nung board exam namin pala. No? 2020. Not so long time ago. So, venous drainage of the stomach. Okay? So, eventually, all of them will drain into the portal circulation. Okay? Pero some will drain directly into the portal vein. Okay? Your left and right gastric vein will drain directly into the portal vein. Yan, tinanong na yan. Okay? The one that drains directly into the portal vein, right and left gastric vein. Okay? Your short gastric vein and left gastroepiploic vein, okay, will join the splenic vein. Okay? While your right gastroepiploic vein, okay, will join the superior mesenteric vein. Okay? And then remember, your splenic vein and your superior mesenteric vein will combine to become your portal vein. Okay? So eventually, lahat sila makakarating sa portal vein. Okay? And may question, no? Kinawindang ng sangkatauhan, no? Kasi tinanong to ng 2022. Okay. Na hindi natin alam saan galing. Okay? There's one vein, no, in your stomach, no, which is not always present. Okay? But it's used as a landmark to locate your pylorus, no? That's known as your pre-pyloric vein of Mayo, no? It marks the pyloroduodenal junction. So hence, the distal end will be the pylorus and the proximal end will be the hypertrophic muscle. Okay? So, this is your, asan na siya? Ito, pre-pyloric vein of Mayo. Okay? Pyloroduodenal junction. Okay? It's used by surgeons to demarcate the start of your pylorus. No? It will drain into your right gastric vein here. Okay. So, after the stomach, duodenum. Okay? Ayan, no? Twice nang tinanong in the past 5 years, no? The only mobile portion of the duodenum is your first part. Okay? So, yeah. Only mobile portion. Kasi siya lang yung hindi retroperitoneal. Okay? So the duodenum is retroperitoneal except for the first inch. Okay? Duodenum is a C-shaped tube. Pasok siya, no? Again, sa dudes with 10 inches. Sa dudes with 10 inches. So, first, no? So, your first part is here at the level of L1. Okay? The first part is known as your superior. No? Kasi siya yung nasa taas. No? Superior part. Eventually, your second part, okay, will descend. No? Kaya nga siya descending portion. Okay? So, superior, and then descending. Okay? And then third, okay, will be your horizontal, no? Horizontal portion. Okay? And then finally the fourth part, okay, pataas, to be your ascending portion. Okay? So as you see, first part is at the level of L1. Okay? Second part, it will span L1 to L3. Okay? Your third part is at the level of L3. Okay, and then your fourth part is at the level of L3 going up to L2. Okay? Okay, so yan na yan. Okay? Yung left, nag-iiba-iba per reference. No? This is coming from Moore. Okay? So the first 2 cm has a mesentery, therefore it is mobile. Okay, so the only mobile portion would be your first part. Okay? It is attached to the hepatoduodenal ligament and the greater omentum. Your second part, it will contain the ducts, the bile duct and the main pancreatic duct drainage. And it is curved around the pancreas, so it's here, this is the second part. Okay, eventually it will receive the bile and pancreatic secretions. Your third part, this is your third part, and as you see, it is crossed by your superior mesenteric vessels. Okay, and finally your fourth part. Okay, your fourth part is supported by the attachment of your ligament of Treitz. Your ligament of Treitz also demarcates the end of the fourth part, or the end of the duodenum, and demarcates the start of the jejunum. Okay, so let's go to the liver. Okay, divides the liver into two true lobes. Okay, two true lobes. Okay, triangular ligament, coronary ligament, line drawn from the gallbladder to the IVC, or falciform ligament. Okay, the answer here is, letter C, a line drawn from the gallbladder into the IVC. Okay, so this pertains to the true lobes, pertains to the histologic functional divisions of your liver. Okay, pero if nag-iba yung tanong, ang tanong is anatomic division, okay, divides the liver into anatomic lobes, ang sagot will be falciform ligament. Okay, so you need to review your coinods segments. Okay, so your coinod segments, yan. Okay, so your coinod segments is yan, in this picture. So you totally have 8 segments, wherein your caudate lobe is your segment 1. Okay, your segment 1 is your caudate lobe, while your segment 4B is your quadrate lobe. Okay, so the rest you need to review na lang. Okay, so just remember, caudate lobe is 1, quadrate lobe is 4B. Okay, moving on. There's one clinical correlation about your liver. Okay, so your liver, how is liver biopsy done? Okay, so number 1, it's done with the patient in full expiration. Okay, for the reason na you need to reduce the size of the costodiaphragmatic recess. Okay, decreasing the likelihood of damaging your lung. Okay, and the question in anatomy, where will you insert your needle? Okay, number 1, definitely it's in the right side, right side, because the liver is in the right side. Okay, and at the 8th or 9th intercostal space, mid-axillary line. Okay, so that's where you insert your needle. Okay, and then the next organ next to your liver is your gallbladder. Okay, it's a pear-shaped organ lying on the inferior surface of the liver. Again, the capacity 30 to 50 ml. Okay, and ito yung question, it's about your fundus. How or at which level will you be able to palpate your fundus? So it lies, or the tip of your fundus is located at the right 9th costal cartilage. Okay, so at the 9th costal cartilage. Okay, next organ would be your kidneys. So your kidneys has several coverings. Okay, tinatanong din in your board exam. Okay, number 1, your fibrous capsule. Okay, so it will surround the kidney along its outer surface. Okay, the next covering would be your perirenal fat. Okay, perirenal fat. Okay, and it covers your fibrous capsule. Okay, it's followed by your renal fascia. Okay, that will cover both your kidneys and your adrenal glands. Okay, and it is continuous laterally with your fascia transversalis. That's the covering that was asked. Your renal fascia covers your kidney and your adrenal gland, and it's continuous with your fascia transversalis. Okay? After your renal fascia, you have your pararenal fat. Okay? So the renal capsule, the blue ones. Okay, this is your kidney. Okay, followed by your perirenal fat. Okay, followed by the renal fascia. Okay, and then your pararenal fat. Okay, you also need to know the order or sequence of the blood supply of your kidneys. No? So coming from your aorta, okay, it will branch off to a renal artery, and then eventually a segmental artery, a lobar artery, interlobar artery, arcuate arteries, interlobular arteries, and then finally afferent glomerular arterioles. And eventually the glomerulus, efferent, and so on. Okay? So again, aorta, renal artery, segmental artery, lobar artery, interlobar artery, arcuate, interlobular, and then afferent glomerular arteries. Okay, next question, no? Tinanong talaga to. Preferred kidney for kidney transplant. Okay, dalawa na lang yung choices mo. Is it left or the right? Okay, and explain. No, ganun na sa board exam, no? Explain why. So the preferred kidney would be the left. No? Okay, what's the reason? No? During renal transplantation, the preference would be your left kidney because it's easier to transplant. Okay, why? You have a longer renal vein, okay, which helps to facilitate the formation of your venous anastomosis. Okay? And then, what happens ba during renal transplantation? No? So, the usual site is in the iliac fossa at the posterior abdominal wall. Okay? Incision will be anterior abdominal wall just above the inguinal ligament. Okay? And then, you anastomose your renal artery here. No? You anastomose it with your internal iliac artery. Okay? While your renal vein, you anastomose it with your external iliac vein. Okay? And then you do a ureterocystostomy. Okay? And then, one question then about anatomy, no? Question about landmarks. So, you're doing a suprapubic cystostomy. Okay? So, what's the function ba of suprapubic cystostomy, no? It's to obtain uncontaminated urine sample, no, for culture. So, this is done with the patient in supine frog leg position. So, that's knee, hip flex, heels on the bed, hips abducted. Okay? And then, where will you insert the needle? Okay? You insert it 1 to 2 cm cephalad to the superior edge of the symphysis pubis. Okay? So, that's your suprapubic cystostomy. Okay? So, that's all about your abdomen. Okay? So, moving on to your pelvis and perineum. Okay? So, recent feedback, no, marami pa rin question about your pelvis and perineum. So, yeah, no? Let's start with this question. It's about your pudendal nerve. Okay, your pudendal nerve is part of your sacral plexus. No? And itong nerve na to ay parang hindi siya makadecide, no? Because it will leave the main pelvic cavity through the greater sciatic foramen, pero siya ay babalik, no? At dadaan ng lesser sciatic foramen, okay, to supply the perineum. Okay? And it passes forward to your pudendal canal, okay, also known as your Alcock's canal. Okay? Your Alcock's canal. Okay? Your pudendal canal. Okay? So, your pudendal nerve, no, from sacral plexus S2 to S4. So, it will form your pudendal nerve here. Yan. So, ito yung greater sciatic foramen, no? Lalabas siya dyan. Okay? Pero, papasok siya sa lesser sciatic foramen. Eventually, it will divide to form your inferior rectal nerve, okay, your perineal nerve, and dorsal nerve of the penis or clitoris. Okay? This is your pudendal canal or your Alcock's canal. Okay? Still, the nerve that passes through there is your pudendal nerve. Okay? So it will supply the external anal sphincter and the muscles of the skin and perineum. Okay? And ito pa yung question, no, about your pudendal nerve. So, you are performing a pudendal nerve block. Okay? So, what's the function? Its function is to anesthetize the skin of the perineum, usually indicated when when the patient is in the second stage of labor. Okay? Or when you're doing forceps delivery and episiotomy. Okay? It can be done using two procedures. It may be transvaginal or perineal. Okay? If it's transvaginal, you apply it or you use the landmark. Okay? Use this landmark, no? The ischial spine if it's transvaginal. If it's perineal, you inject just at the medial of the ischial tuberosity. Okay? So the example is here, no? This is a transvaginal procedure, no? You are palpating for the iliac spine, ischial spine, and then you inject there. Okay? To anesthetize the pudendal nerve here. Okay? So that's your pudendal nerve block. Okay, next question. Which of the following vessels supply the prostate gland? Okay, superior rectal artery, superior vesical artery, middle rectal artery, inferior vesical artery. Both A and B, both C and D. Humabot ng F yung choices. Okay? So, the one that supplies your prostate, okay, includes your middle rectal artery, okay, and your inferior vesical artery. Okay, so both C and D. Okay? May similar question in your board exam, no? Paano siya tinanong, no? You're doing prostatectomy, okay, to a patient, and then what vessels will you need to ligate? Okay? So same, no? Basically, it asks about the blood supply of your prostate gland. So it's coming from middle rectal artery and inferior vesical artery. Okay? So your prostate, no, around 1.5 inches long, the largest of the accessory glands in males. Okay? Chestnut shape, fibromuscular, glandular organ. Okay? It's responsible for prostate-specific antigen, okay, to secrete PSA, no, prostaglandin, citric acid, and acid phosphatase. It is also responsible for the characteristic odor of the semen, okay, and it makes the semen alkaline, no, to help neutralize the acidity of the vagina. Okay, so these are the relations of your prostate. Okay, number 1, so ito yung prostate, no? Superiorly, you have the neck of the bladder. Okay, inferiorly, you have here the urogenital diaphragm. Okay, anteriorly, okay, it's represented by your symphysis pubis, okay, and the retropubic space of retsus. Posteriorly here, okay, you have the rectal ampulla, okay, and the Denon-Villiers fascia here. Okay, and laterally you have the levator ani. Okay, so your prostate is still further subdivided into several lobes. Okay, number 1, you have the anterior lobe or your isthmus, okay, which is devoid of glandular tissue. Okay, how will you remember? Anterior lobe, ala siyang glands, no? Ala siyang glands, anterior lobe. Okay, it's devoid of glandular tissue. Okay, anterior region, non-glandular. Your median or middle lobe, okay, it's a wedge of gland situated between the urethra and the ejaculatory duct. Okay, your median or your middle lobe. Okay, it is the portion prone to BPH. Okay, the portion prone to your BPH. That's your median or middle lobe. Okay, while your posterior lobe, okay, it's the one prone to your prostate cancer. Okay, posterior lobe for prostate cancer, middle lobe for BPH. Okay, while your lateral lobes, okay, it's the largest, no? It forms the main mass of the gland. Okay, and as mentioned, the blood supply is coming from your inferior vesical and your middle rectal arteries. Okay? Lymph drainage to the internal iliac nodes and nerve supply from your inferior hypogastric plexuses. Okay? Again, make one question about your anti-sperm antibodies. Parang histology question to. No? So, your anti-sperm antibodies, it's present both in males and in females and responsible for infertility, no, in some of the patients. No? Around 9 to 12% of infertile patients has anti-sperm antibodies. No? What's unique about it, no? So in women na merong partner na may anti-sperm antibody, so magre-react sila, no? Magre-react yung women to the semen of the male or their partner with anti-sperm antibodies. However, no, what's interesting, no, if that woman has another partner, it will not react to the sperm of other males. No? So pwedeng pwede siyang mabuntis sa ibang males, no? Na no? Pwede siyang mabuntis basically sa ibang males, no? But not with his partner with anti-sperm antibodies. Okay? So, na-recall siya before, no? Pero hindi ma-recall kung what specific question, no? Just be familiar with your anti-sperm antibodies. Okay, next. The mucosa of the fallopian tube is most pronounced at which part? No? Isthmus, infundibulum, ampulla, fimbria, or none of the above. Okay, so the mucosa is most pronounced at the infundibulum. Okay, infundibulum. Next, innervation of the fallopian tube. Enumeration. Enumeration sa board exam. Okay, so the innervation comes from your T10 to L2, pelvic splanchnic nerves, and your vagus nerve. Okay? Again, T10 to L2, pelvic splanchnic nerve, and your vagus nerve. Okay. Next, no? Ang walang kamatayang ureter, ang course ng ureter. No? Ang tagal lang hinahanap ng course niya. Saan ba siya nag-enroll? Okay? So, your ureter, so it has two parts, your abdominal part and your pelvic part. Okay, so starting here, let's trace the course of the ureter, no? From your kidneys or urinal pelvis, so becomes your ureter. So it will descend in front of the psoas major. Ito yung psoas, no? Yung green, no? So it lies in front, anterior to the psoas major. And then at the level of the sacroiliac joint, no, it will cross the pelvic brim. No? And as you see, may vessel na nag-cross sa kanya. No? Your testicular artery, or your ovarian artery, or your gonadal artery. Okay? So, dito mag-a-apply yung water under the bridge. No? Water under the bridge. Which means, your ureter is below, is posterior to your gonadal artery. Okay, so your gonadal artery passes over your ureter, no? At the level of the SI joint or pelvic brim. Okay? And then, ano pa yung tatawiran niya? Okay? It will pass in front of the common iliac artery. Okay? It will pass in front or at the bifurcation of the common iliac artery here. Okay? And then, magiging pelvic part na siya, no? Kasi cross na siya ng pelvic brim. Tama? So, it will travel at the lateral pelvic wall and at the level of the ischial spine, okay, magta-turn na siya. No? Magta-turn na siya anteromedially to pierce the bladder. Okay? So, asan siya? Ito ulit, si ureter, pelvic brim. Okay? Anterior to the bifurcation of common carotid artery. Sa lateral wall ng pelvis, then mag-turn anteromedially. Okay? But there are differences, no, in males and in females. Okay? Natanong to, no? Recent exam. Okay? Sa males, walang problem, no? Kasi in males, before it pierces the bladder, it will be crossed by one structure. Okay, your vas deferens. Okay, your vas deferens will cross the ureter before it pierces the bladder. Tinanaw na din yan. Okay, the structures that crosses the ureter before it pierces the bladder in males, vas deferens. However, in females, no, what you need to take note, during oophorectomy, okay, care must be taken because the ureter lies close to your ovarian arteries, no, at the level of the pelvic rim, no, as we mentioned. Okay? Also, during hysterectomy naman, okay, just 2 cm superior to the ischial spine, okay, the ureter will run under the uterine artery. No? So, care must be taken again. Okay, now let's move on to your extremities. Okay, your extremities. So, which of the following does not receive nerve fibers from C8 nerve root? Okay, C8 nerve root. Ulnar nerve, long thoracic nerve, radial nerve, median nerve, or medial pectoral nerve. Okay? So, your ulnar nerve roots is C8T1. Okay? Your medial pectoral nerve is C8T1 as well. Okay? So, pasok. May C8, may C8. Eliminate. Your median nerve is C5 to T1. Okay? So, may C8 pa din siya. Tama? Your radial nerve is C5 to T1 as well. Okay? So, the answer here is long thoracic nerve. No? Because your long thoracic nerve roots is C5 to C7. Okay? I hope you remember your brachial plexus, no? And paano siya i-drawing, no? Kasi recent exam, para mga 5 questions, no? Based on feedback, 5 questions about the brachial plexus, nerve roots, clinical correlations. Okay? So, pero if hindi pa na review, let's run down ulit. So, your brachial plexus, no, is formed by the nerve roots from C5 to T1. Okay? C5, C6, C7, C8, T1 roots. Okay? From the roots, meron ng nerves na nag-originate, no? From C5 to C7, you have your long thoracic nerve, okay, which innervates the serratus anterior. Tama? Serratus anterior. C5 to C7, long thoracic nerve. Your dorsal scapular nerve, okay, originates from C5 naman, okay, which innervates your rhomboids, okay, in your your rhomboids in your levator scapula. Okay, naalala pa? Mnemonic natin, di ba? Yung door, meron kang door sa room, saka sa elevator. Okay? So, rhomboids, levator scapula, dorsal scapular nerve. And then, C5, C6 will combine to form the upper trunk. C7 is alone to form the middle trunk. Okay? C8, T1 will combine to form your lower trunk. Okay? And from the upper trunk, you will have nerve to subclavius. Okay? Definitely, it will supply your subclavius muscle. Okay? And you have your suprascapular nerve to supply your infraspinatus saka supraspinatus. Okay? Suprascapular nerve, supraspinatus, infraspinatus. And then, okay, each trunk will give off an anterior division and a posterior division. Okay? Can you follow? Anterior and posterior division. Lahat ng posterior magsasama-sama, no, to form your posterior cord. Anterior division ng upper and middle will form your lateral cord. Okay? And yung anterior division ng lower trunk will form your medial cord. Okay? Forming the final branches. Okay? So, your lateral cord, okay, Ang mnemonic is lalamove, no? Lalamove. Lateral pectoral, okay? Lateral root of the median nerve in your musculocutaneous, okay? Musculocutaneous nerve. Next, your posterior cord, okay? Ang mnemonic is ultra. Upper subscapular, lower subscapular, thoracodorsal, radial, axillary. Okay? While your medial cord, okay, lahat sila puro medial nagsisimula. Okay? Medial pectoral, medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, medial root of the median, and your ulnar nerve. Okay? So, yung question, yon na tanong nyo, no? Sino yung walang supply from C8 to T1, no? So, lahat sila meron, no? May C8 to T1. Okay? Especially itong medial cord, no? C8 to T1. Ano pa yung mga tanong? Okay? Ano yung mga terminal branches of your brachial plexus? Okay? The terminal branches of your brachial plexus is no? Mumar, no? Musculocutaneous, your ulnar nerve, okay? Your median nerve, okay? Your axillary nerve, okay? And your radial nerve, okay? Those are the terminal branches of your brachial plexus. Mumar, musculocutaneous, ulnar, median, axillary, radial. Lagyan mo na ng star. Tinanong nga yan, ha? Tinanong last exam. Okay? Okay, memorize by heart ang brachial plexus. Okay? Next, a 4-year-old patient sustained a supracondylar fracture of his right humerus. Which of the following muscles will be most likely affected? Okay? Two-step question, no? Meron kang supracondylar fracture. And remember, supracondylar fracture affects what nerve? Okay, median nerve. Okay, median nerve. So in here, okay, isa-isahin natin. Sensation to the first web space. No? So first web space, it's supplied by the superficial branch of your radial nerve. No? So hindi na yan yung sagot. Letter D, coracobrachialis is supplied by your musculocutaneous nerve. Okay? Di na yan. FCU, no? FCU is supplied by your ulnar nerve. Okay? And your supinator is supplied by your radial nerve, no? So the answer here, okay, the one supplied by your median nerve is your flexor pollicis longus. Okay? So let's try to differentiate median, ulnar, radial, no? Nerve supply of the hand, no, and forearm. Motor in general, no, flexor and pronator groups is supplied by your median nerve, no, except for the FCU and FDP medial half. Okay? All thenar muscles supplied by the median nerve, okay, and lateral 2 lumbricals. Okay? Sensation, okay, supplies the palm as well as 3.5 fingers, no? 3.5 fingers. Like drawing pa. So wala akong picture, sorry na. So 3.5, no? Ito median nerve. Okay? Clinical presentation, benediction hand, no? Benediction hand, median nerve injury yan. Your ulnar nerve, so it will supply the FCU, medial half ng FDP, no? And intrinsic muscles of the hand, no? Like your palmar dorsal interossi and the medial lumbricals, yun pa, no? And your hypothenar muscles. Sensation, it will supply the medial 1.5 fingers. Sorry, your median nerve, palmar aspect lang to, no? Palmar aspect na 3.5 fingers. Okay? Your ulnar nerve, gawin na naman, no? Kamay yan, ha? It will supply the medial 1.5, no? This is small finger, saka 1/2 ng ring finger. Okay? Medial 1.5, both palmar and dorsal surface. Okay? Manifestation, if may injury, you have claw hand. Okay? Your radial nerve, it supplies triceps and extensor muscles of the forearm. Okay? It will supply skin at the posterior forearm, lateral aspect of the dorsum of the hand. Okay? Specifically, your superficial radial nerve, SRN. And the dorsal surface of the lateral 3.5 fingers. Okay? So, dorsal surface, ito yung thumb. Ito yung thumb. 3.5 daw. 1, 2, 3, 1/2. No? Pero, provided dorsal surface. No? Kasi pag palmar surface, it's median nerve. Okay? And clinical correlation, pag may injury, you will have wrist drop. Okay? Wrist drop. Inability to dorsiflex the wrist. Okay, next question. A 48-year-old woman sustained the fracture of the middle third of the humerus. No, which of the following muscles is least expected? Which of the following muscles is least expected? Okay, letter A, triceps brachii. Letter B, wrist extensors. Letter C, supinator. Letter D, coracobrachialis. Okay, least expected. Sige, no? Two-step question muna ulit. Middle third of the humerus, which nerve will be affected? Okay, that's your radial nerve, no? Triceps brachii, no? Innervation. Correct, no? Radial nerve. Wrist extensors supplied by, correct again, no? Radial nerve. Supinator is supplied by radial nerve as well. And your coracobrachialis is supplied by your musculocutaneous nerve. Okay, musculocutaneous nerve. So that's the incorrect answer. No, least expected weakness from your coracobrachialis. Okay, next. Which of the following muscles may cause some weakness in shoulder flexion? Okay, weakness of which of the following may show weakness of shoulder flexion? Brachialis, brachioradialis, okay, anconeus, or biceps brachii. Okay, brachialis will only cross the elbow joint. Okay, so hindi na siya yung sagot. Okay, brachioradialis only crosses the elbow joint, no? Weak flexor of the elbow joint. Your anconeus also only crosses the elbow joint, no? And extensor siya, no? Extensor siya ng elbow. Okay? Shorted of triceps is also an extensor. So it will not result into weakness in shoulder flexion. So if you have injury to the biceps brachii, no, it crosses the shoulder joint, no? It's a weak shoulder flexor and a strong elbow flexor. Okay, so if you have injury in your biceps brachii, you may have some weakness in shoulder flexion. Okay, so that's the correct answer. No? Letter D. Okay, next question. No? Lateral boundary of your cubital fossa. Okay, pronator teres, supinator, skin and fascia, median nerve, brachioradialis. Okay, so the lateral boundary is formed by your brachioradialis. No, your pronator teres, it's a medial boundary. Your supinator, okay, it's the floor, no? It's the floor of your cubital fossa. Okay, your skin and fascia is the roof. Okay, while your median nerve is one of the contents of your cubital fossa. Okay, so your cubital fossa is a triangular depression in front of your elbow. Okay, let's look here na lang, no? So this is your lateral boundary, no? Formed by your brachioradialis. Okay, this is your medial boundary formed by your pronator teres. Superiorly, it's bounded by imaginary line, no? Formed by your two epicondyles. Okay, so you now have a triangle, no? So that's your cubital fossa. Okay, at the floor, hindi kita dito, you have the supinator and brachialis. Okay, and the roof will be formed by your skin and fascia, the basipital aponeurosis. Okay, and yung contents, okay, if you remember, okay, media at radyo, no? Media at radyo, ang mnemonic natin, no? From medial to lateral, no? Median nerve, brachial artery, biceps tendon, then your radial nerve. Okay, so that's your cubital fossa. Okay, sige. Moving on, fast talk, no? Fast talk muna ulit. Benediction hand, no? Anong nerve ang injured, no? Benediction hand, correct, no? Median nerve. Median nerve. Again, claw hand deformity. Claw hand deformity. Okay, that's your the one injured is your ulnar nerve. Fibular head fracture. Okay, pag nag-fracture yung fibular head, no? Ni-injure yung nerve that winds around its neck. That's your common peroneal nerve. Okay, Saturday night palsy, no? Pag ikaw ay nakakatulog, nag-party ng Saturday, no? Naiipit along the shaft of humerus. That's your radial nerve. Okay, foot drop. Your foot drop injures your common or deep peroneal nerve. Okay, the one injured in your foot drop, no, it's either common or deep peroneal nerve, no, because it supplies the dorsiflexors. Surgical neck fractures, no, neck fractures. Because this nerve winds around your surgical neck, okay, it's prone to injury, no, during surgical neck fractures. Axillary nerve. Okay, next, ape hand deformity. Ape hand deformity, okay, pag nag-atrophy yung pag nag-atrophy yung thenar muscles, okay? So the one injured is your median nerve. Okay, next, Trendelenburg sign. Okay, Trendelenburg sign is a sign of weakness of hip abductors, no? Specifically your gluteus, medius, and minimus. Okay, and remember, your gluteus medius and minimus is innervated by superior gluteal nerve. Okay, distal humeral fracture. Okay, pag nag-fracture sa distal humerus, na-affect siya, no? Kasi nandun siya. Your median nerve. Okay? What about your medial epicondyle fracture? Okay? Your medial epicondyle fracture, okay, nagka-pass through yung nerve na ito, no? Kaya pag nag-fracture sa medial epicondyle, na-affect siya, your ulnar nerve. Okay, next. So there were orthopedic question, no, previously in the past siguro mga 2 or 3 board exams, no. Yung question is essay. Essay, differentiate Heberden versus Bouchard nodes, no. Sabi na essay, minimum of 100 words. So your Heberden's nodule versus Bouchard nodes, okay, they're different in terms of location lang naman, no? So your Bouchard's node, okay, is located in the PIP joint, okay, while your Heberden's node is located at the DIP joint, no? And both of them are associated with osteoarthritis. Okay? Paano matatandaan, no? Yung DIP, di ba, mas distal, mas malayo, no? Doon ka sa mas mahaba, no? Sa mas mahaba, sa DIP, no? Kasi mas malapit yung Bouchard. Okay? So, asan siya? Bouchard node is here at the PIP. Okay? Heberden, nasa mas mahaba. Okay? Sa distal. Interphalangeal joint. Okay? Next essay for 3 points. Boutonniere versus swan neck deformity. Differentiate. Okay? You can differentiate them in terms of etiology and yung position ng deformity. Your boutonniere's deformity, no, is due to rupture of the central slip over the PIP joint. Okay? And, ano itsura niya? Para ka daw nagbobotones, no? You have a PIP flexion and DIP extension. Okay? While your swan neck, no, the pathology is in the volar plate. Okay? You have hyperextension ng PIP, then flexion ng DIP. No? And both are associated with, okay, this time it's rheumatoid arthritis. Okay? So this is boutonniere, flexion ng PIP joint, extension ng DIP joint. Okay? While your swan neck is extension ng PIP joint, and flexion ng DIP joint. Okay? So may question din, no? This time, they want you to differentiate deep peroneal nerve versus superficial peroneal nerve. So these nerves are continuation of your common peroneal nerve. So your deep peroneal nerve, no, it's on the lateral side of the neck of the fibula. It passes behind the extensor retinaculum, no, and it supplies tibialis anterior, EDL, peroneus tertius, and EHL. Okay, as well as the eccentric digitorum and hallucis brevis. Okay, and it supplies the sensation over the first web space. So if you have injury in your deep peroneal nerve, okay, you will have loss of sensation at the first web space, no? Here. Yeah, no? It's innervated by your deep peroneal nerve. While your superficial peroneal nerve, it supplies your peroneus longus and brevis. Okay, and it will supply the dorsum of the foot. Going back. So this is the supply of your superficial peroneal nerve. No, it will supply the dorsum of the foot and part of the anterolateral part of the leg. Okay, superficial peroneal nerve. Okay, next. A 29-year-old patient presents to you at the clinic with loss of sensation at the medial thigh and inability to extend the knee. No? What nerve is most likely affected? Okay, so inability to extend the knee. Okay, remember, anong muscle group yung nag-extend ng knee? Okay, that's your quadriceps, no? Your quadriceps. Okay, and your quadriceps is innervated by, okay, your femoral nerve. Okay, next. Muscle that originates from the anterior superior iliac spine, okay, and acts to flex the hip and the knee. Okay, sartorius, iliacus, psoas, pectineus, okay, or rectus femoris. Okay, the answer here is your sartorius, no? The recent questions, no, sa board exam, medyo mainit sila sa sartorius. No? Hindi ko alam bakit, pero one of the favorite muscle lang, sartorius. Okay? It originates from the anterior superior iliac spine, okay, and inserts, no, at the upper medial surface of the shaft of tibia. Okay? Together with your gracilis and your semitendinosus, no? Pare-pareha sila ng insertion. It is supplied by your femoral nerve and it acts to flex, abduct, and externally rotate the hip. Okay? Flex, abduct, and externally rotate the hip. Okay? And because it crosses the knee joint, no, it can also do knee flexion and internal rotation. Okay? So that's all for the extremities. Okay, now let's run down some questions about neuroanatomy. Okay? So, first question, the thalamus is derived from which secondary brain vesicle? Okay? Secondary brain vesicle. A. Telencephalon, B. Diencephalon, C. Mesencephalon, D. Rhombencephalon, E. Myelencephalon. Okay? So, it comes from your, okay, diencephalon. Okay? So, embryonic brain regions, no, it will start with three. You have the forebrain, midbrain, and your hindbrain. Okay? Your forebrain is also known as your prosencephalon. Okay? Your midbrain is otherwise known as your mesencephalon. Okay? In your hindbrain is also known as your rhombencephalon. Okay? So your forebrain will divide into two, telencephalon and then diencephalon. Your telencephalon will become, in mature individual, it will become your cerebrum, cerebral cortex, white matter, and basal nuclei. Okay? While your diencephalon, okay, it will become the diencephalon in mature individuals. No? Maintain lang. Okay? And, okay, ito yung shet, no? Shet. Subthalamus, hypothalamus, epithalamus, and thalamus. Okay? Basta lahat ng thalamus, may thalamus sa pangalan, it will come from your diencephalon. Your midbrain, okay, maintain lang, no? Mesencephalon, okay, eventually, magiging midbrain in mature adults. Your hindbrain, okay, it will divide into meten and myelencephalon, okay? Your metencephalon will give rise to the pons and cerebellum, while your myelencephalon will give rise to the medulla oblongata. Okay? Okay, one question in a board exam, no? At what number of days or weeks, no, magfo-form yung primary vesicles, no? It will form, okay, after the neural tube has closed, okay, which is at 28 days. Okay? While your secondary vesicles will form at 5 weeks, no? So primary vesicles at 28 days, secondary vesicles at 5 weeks. Okay, next, no? Ano ulit, no? Essay na naman, no? Fill in the board exam question, fill in the table. Trigeminal versus facial nerve. Okay? Your trigeminal nerve supplies the muscles of mastication. Okay? While your facial nerve, okay, supplies the muscles of facial expression. Okay? Easy. Tensor tympani, again, yung mnemonic natin, letter T, no? T, tensor tympani, trigeminal. Tensor veli palatini, trigeminal. Okay? Anterior belly ng digastric sa harap. Tama? Anterior belly ng digastric. Posterior, number 7. No? 7. Posterior belly. Si Milo hyoid, Milo is 5 piso. No? 5 pesos. Cranial nerve, 5. Okay? And then stapedius, stylohyoid, letter S, no? 7, cranial nerve. Okay, 7. So, yan yung mga muscles supplied by your trigeminal and facial nerve. Okay? What about the sensation? No? Your sensation and taste, no, of the tongue, no? Ito. Okay? So, anterior 2/3 on division. Anterior 2/3, you have posterior 1/3, and you have the epiglottis. Okay. Doon muna tayo sa walang issue, no? Sa walang issue. Epiglottis, no? Taste and sensation parehas vagus nerve. Okay? Taste and sensation vagus nerve. Okay? Ano ba pag sinabing sensation, no? Sensation, light touch, heat, blah blah blah. Okay? Pain. Okay. While taste, no? Taste kung sweet, sour, no? Kung masarap. Yan, no? Magkaiba ang taste versus sensation, no? That's my point. Okay, pero sa epiglottis, parehas sila, it's served or it's innervated by your cranial nerve 10, vagus nerve. Sa posterior 1/3, no? Sensation and taste, wala ring issue. Kasi cranial nerve 9 parehas. No? Cranial nerve 9 parehas. Glossopharyngeal nerve. Okay? Ang issue sa anterior 2/3, no, nasa harap, no, because the taste, okay, is served by your facial nerve, no, via the chorda tympani. While the sensation, okay, it's supplied by your mandibular nerve from your lingual nerve, which is a branch of your cranial nerve 5. Okay? So, yon. Okay, that's the innervation of your tongue. Okay, next. Papes circuit, no? Dalawang star. Last exam, saka last exam, no? Lumabas siya, no? Your Papes circuit. Okay, your Papes circuit, okay, is a circuit, no, that starts with your hippocampus and ends with your hippocampus. Okay, so malamang kasama siya. So, sa question kasi, which of the following is not part of the Papes circuit? Okay? Kasama si mammillary bodies, kasama si parahippocampal gyrus, no? Kasama si cingulate gyrus, no? Ang hindi kasama si posterior thalamic nuclei. Should be anterior, no? Should be anterior thalamic nuclei. So your Papes circuit, it's a circuit that ties together the cerebral cortex and your hypothalamus. Okay, cerebral cortex and your hypothalamus. It provides anatomic substrate. Okay, it provides anatomic substrate for the convergence of cognitive activities, emotional experience, and expression. Okay? In simple terms, no? Cerebral cortex for the memory, and then the Papes circuit connects it to the emotional centers, no? To give emotions to what you can what you can recall, no? For example, ganito, no? October 21 is your board exam. You know it because na alam mo na sinabi sa iyo na board exam sa October 21, no? So that's the that's the memory. Pero the emotions to it, no? The emotions, yung kaba, excitement, no? It's served by your emotional centers, no? Pero so pag sinabi ko sa yung October 21 board exam na, okay? You feel nervous, excited and all. Okay? That's because you have the Papes circuit, no? The memory na board exam na, okay, is put in with emotions. Parang ganon, no? Another example, no? Yung boyfriend mo, no? Kunwari may perfume siya, no? May perfume siya na favorite niyang ginagamit, no? So, naalala mo siya, alam mo yung sensation, no? Yung smell ng pabango niya, no? Because of the cerebral cortex. So, maalala mo siya, no? Because it's put into your memory. Nag-break kayo, ganyan-ganyan, no? And then, after some time, no? May nakasabay ka sa sabay ka sa train, no, na same perfume, and then you remember your ex. Naalala mo siya, no? That's because of your Papes circuit, no? Memory plus emotions. Okay. So hindi naman yun yung tinatanong. No? Tinatanong, ano yung kasama sa Papes circuit, no? So it starts with your hippocampal formation, fornix, no? Mammillary bodies, mammillary thalamic tract, anterior thalamic nucleus, cingulum, okay, to the entorhinal cortex, eventually going back to your hippocampal formation. Okay, so that's your Papes circuit. Okay, next. The cerebrospinal fluid is secreted mainly by, okay, arachnoid granulation, ependymal cells, choroid plexus, or the brain substance. Okay? Number one item that you eliminate is your arachnoid granulation, no? Kasi your arachnoid granulation is for absorption. Okay, hindi siya kasama. Okay? And then the rest, no? All of them secretes, no? CSF. Okay? But the main producer is your choroid plexus. Okay? So your choroid the formation of CSF, okay, is performed by the choroid plexuses, okay, within the ventricles, ependymal cells, and the brain substance. Okay. And the absorption is done by the arachnoid villi, okay, and some other structures like the veins in the subarachnoid space and the perineural lymph vessels. Okay, here. So this is the ventricular system, okay? So your ventricular system will start at the production muna, no? Production starting with your choroid plexus, no? So go back. start with your choroid plexus, no? In your lateral ventricle. So from the lateral ventricle, it will pass through your foramen of Monro, okay, to reach your third ventricle here. From the third ventricle, it will pass to the aqueduct of Sylvius. Okay, aqueduct of Sylvius to go to the fourth ventricle. After the foramen of fourth ventricle, okay, it will pass to median and lateral apertures. Okay, median and lateral apertures to reach your subarachnoid space. Eventually, to your arachnoid villi. Ito kasi yung mnemonic, no? Your mnemonic, Lady Monroe has 3 aqueducts that goes to 4 luscious magical subarachnoid places. Oh, that's from Google. Okay? Pero yung sa atin, come, let's formally take Sylvia for lunch mamaya sa aristocrat. Okay? Come, ibig sabihin, choroid plexus, no? Let's, no? Let's for lateral ventricle. F is for foramen of Monroe. Sorry. Okay, foramen of Monroe. Okay, or interventricular foramen of Monroe. After that, F, no, letter T, no? T for the space. Third ventricle. Okay? Third ventricle, pass through the aqueduct of Sylvius to reach the fourth ventricle. Okay? And then, it will pass through the lateral aperture, okay, which is the foramen of Luschka, okay, and the median aperture, okay, which is the foramen of Magendie. Okay, Magendie and Luschka. Okay? Finally, it will reach to your subarachnoid space. Okay, subarachnoid space. And eventually, it will be absorbed by your arachnoid villi. Okay, again, choroid plexus, lateral ventricle, foramen of Monroe, third ventricle, aqueduct of Sylvius, fourth ventricle, Luschka Magendie, subarachnoid space, arachnoid villi. Okay? Next, this thalamic nucleus relays common sensation from trigeminal lemniscus and gustatory fibers to the primary somatic sensory cortex. Okay? Meaning to say, trigeminal lemniscus to the gustatory fibers. Okay? Basically, it asks you about the sensation of the face. Okay? Face. Okay? And it is served by your VPM, ventral posteromedial nucleus of the thalamus. Okay. I just put this topic no because hindi siya na emphasize no during in your handout no. But there was one question pa lang naman so far about this topic. So your thalamus kasi, as you remember, it is the major relay center of all sensation in the body, no, except for olfaction. And it is divided, it has several subdivisions, no? So yan yung thalamus mo, okay, with its subdivisions. Okay, isa-isahin natin, no? So your anterior, okay, anterior thalamic nuclei, it's responsible for emotional tone memory, no? The mnemonic is, no, ala-ala in your affect, no? It is served by your anterior thalamic nucleus. Your dorsomedial is responsible for emotional feelings as well and subjective state, no? Damdamin, dorsomedial, no? Damdamin, dorsomedial. So, ventral anterior, no? Motor, no? Ang mnemonic ko, MVA, no? Motor, si ventral anterior. Motor, ventral anterior. Okay? While si ventral lateral coordination. Ventral lateral coordination. Okay, ito na yung tanong, no? Ventral posteromedial, medial kasi for muka. While ventral posterolateral, okay, sensation of the limbs, no? Lateral limbs, LL. medial muka. Okay? Next, geniculate bodies, no? Your medial geniculate bodies, for medial, it's for hearing, no? For music, no? Medial, music. While lateral is for vision, no? Lateral, light. Okay? For the vision, no? And some, ayan, no? Ito yung ibang thalamic nuclei. Okay? Interlaminar, reticular, mga pulvinar, and your midline, no? Next, no? Rhinorrhea is associated with fracture of which bone? Okay? Rhinorrhea is associated with fracture of which bone? Okay? It's a fracture of your ethmoid bone. Okay, next. Okay, there were questions about your brain functions. No? In general lang, no? Just look at this diagram. No? So in general, frontal lobe is responsible for movement, no? Mga high-level activities, decision-making, thinking, logic, no? Emotions. Okay? Your parietal lobe is responsible for sensation in general. No? Your occipital lobe is responsible for vision. Okay? While your temporal lobe is for hearing. No? Parang ito yung tinanong before. No? Lobe that is responsible for hearing, it's your temporal lobe. Okay? Your cerebellum is responsible for your coordination. Okay? While your medulla is responsible for mga physiologic functions, no? Heart rate, breathing, etc. Okay? And I think this is a final topic, no? About the blood supply of the brain. So, which of the following statement is true of the middle cerebral artery? Letter A, it gives off central branches to supply the white matter of the brain. Does it supply the entire lateral surface, including the inferolateral surface and occipital pole? Letter C, it runs laterally to the lateral cerebral sulcus to supply the lateral surface of the hemisphere. Or letter D, it supplies all motor area, including the legs. Okay, ayan, no? The answer is letter C. No, what's wrong with letter B? No, it supplies the entire lateral surface except the occipital pole and inferolateral surface of the hemisphere, no, because it's supplied by your PCA. Okay? Letter D is incorrect also because it supplies all motor except yung part ng legs, no, because it's supplied by your ACA. Okay? No, so the arteries of the brain, no, will start with the formation of the two main supply of the brain, no. It's coming from your internal carotid artery. You have a pair, okay, and a pair of vertebral arteries. So these four arteries lies within the subarachnoid space, no, and at the base of the brain it will form your circle of Willis. So let's discuss first the internal carotid artery. So it begins at the bifurcation of the common carotid artery. Okay, it will pass to the carotid canal, okay, and runs horizontally to the cavernous sinus. Okay, and then it has several branches, no, including your ophthalmic artery. No, as you remember, it passed through the optic canal. You also have a posterior communicating artery and a choroidal artery. So it's here. Okay, so this is the cerebral part. Okay. You also have the cavernous part. Remember, you have a superior hypophyseal and inferior hypophyseal artery. Okay, which supplies your pituitary. No? Nandito siya sa cavernous part. Okay, the cerebral part is here. No? Okay, next. No, let's start with the anterior cerebral artery. Your anterior cerebral artery, it's the smaller branch. Okay? It supplies all the medial surface, okay, and a strip of cortex laterally, no? So lahat ng medial kanya except lahat ng medial kanya, and then kukuha pa siya sa lateral ng mga 1 inch. And it will supply the leg area, no? It will supply the leg area. Lagyan mo na ng star, no? One of the most recalled question. ACA infarction will cause weakness of the legs, no? ACA, pag nag-stroke ka sa ACA, it will cause weakness of the legs, no? Because yun yung supply niya. Okay? So the yellow portion is your ACA, no? It will supply the medial portion. Okay? And then, nakita niya, no? May kurot ng konti sa lateral na mga 1 inch. Okay? And based on the homunculus, okay? So your homunculus, this is the medial portion, no? So your medial portion, majority will supply the legs, no? Hip, knee, ankle, toes, no? And genitals. Okay, so that's why if you have infarction of ACA, predominantly weak ang lower extremities. Okay. Now, in contrast to your middle cerebral artery, no, it's the largest branch of the internal carotid artery. It supplies the entire lateral surface, okay, except the part supplied by yung kinurot, no, ng anterior cerebral artery. Okay. And it will supply the entire lateral surface except for the occipital pole and inferolateral surface because it's supplied by your posterior cerebral artery. It will supply all motor except the leg. No? And again, leg area is supplied by your ACA. Okay, so the red portion is here. No? Entire lateral surface except yung kinurot ng ACA and except yung inferolateral surface and yung occipital pole. Okay? Kasi PCA na yan. Okay? So after your internal carotid artery, you have the vertebral artery. No? It's a branch of the first part of the subclavian artery. And it passes through the transverse foramen transversarium of your upper 6 cervical vertebrae. Now, as you remember, you have 7 cervical vertebrae. However, no, yung vertebral artery, dadaan lang siya sa upper 6, no, because the foramen transversarium of C7 is rudimentary, no, and too small, no, para makapag-pass through si vertebral artery. So your vertebral artery will enter the foramen magnum, remember, no, together with your medulla oblongata and cranial nerve 11. Okay, and at the lower border of pons, now your vertebral artery will join together to form your basilar artery. So these are the branches. You have meningeal branch, you have posterior spinal arteries, you have anterior spinal artery, you have the posterior inferior cerebellar artery and medullary arteries. Okay, so your vertebral arteries, again, will unite to form your basilar artery. Okay? And then, after, so at the upper border of the pons, remember, no? At the lower border of pons, mag-unite yung vertebral arteries. Asan siya? This is your vertebral arteries, no? At the lower border of pons, mag-unite sila to form your basilar artery. And at the upper border of pons, magdi-divide na siya, no, into posterior cerebral arteries. So you have the right and the left. Okay, so these are the branches of your basilar artery. You have the pontine artery, labyrinthine artery, anterior inferior cerebellar artery, and superior cerebellar artery. Okay, and the one important is your posterior cerebellar artery. Now, it supplies your visual cortex, part of the thalamus lentiform nucleus. Okay, as mentioned, okay, yung blue portion is supplied by your PCA. Okay, next, now vessel involved in epidural hemorrhage, no? Epidural hemorrhage. Okay, middle meningeal artery, superior cerebral veins, aneurysm at the circle of Willis, okay, lenticulus radiate artery, middle cerebral artery. Okay. So the vessel involved is your middle meningeal artery. Okay, so your middle meningeal artery is affected in epidural or extradural hemorrhage. No? Tinanong yan in the recent exam. No? While subdural, it will affect your superior cerebral veins, no? At their point of entrance into the superior sagittal sinus. Okay, subarachnoid hemorrhage, usually there's a background of aneurysm, no, at the circle of Willis. And yung common cerebral infarction usually affects your lenticulus radiate artery of your middle cerebral artery. Okay, I think this is the last question. Now, which of the following is not part of your circle of Willis? Anterior communicating artery, anterior cerebral artery, middle cerebral, posterior communicating or posterior cerebral. Okay, the one that is not part is your middle cerebral arteries. Okay. So this is your circle of Willis, no? So it's formed at the base of the brain, no, by your two internal carotid and two vertebral arteries. So ano yung components, no? Let's start from anterior to posterior. So this is your anterior communicating artery, the two anterior cerebral arteries, okay, your internal carotid arteries, of your posterior communicating arteries, and your posterior cerebral artery and basilar artery. Okay? So hindi kasama, ito siya, no? Your middle cerebral arteries, no? Does not participate in your circle of Willis. Okay? I think that's all, no? Lahat ng pwede nyong daling bala, no, para sa board exam for anatomy and histology and some neuroanatomy, no? I hope you're able to learn a lot, no, during this period, and I hope you enjoyed, no, learning anatomy as well. Let's good luck in your exams and see you sa oath taking. No? Good luck everyone. Thank you for listening.